Who's on there? It's her. I think it's her. It's curly haired gal talking.
Okay. Tell me where to go from there. Right here. No, always here, there, yeah. Because I can't look at the back. So.
That's what we're looking at.
Can you see both chairs?
Yeah, I can see
Because I can move it, keep it there, okay? I can move it back a little bit more like that and center it. Now what is it like? Were you adjusting the focus? See what it says on the screen. It says it's streaming here.
Wow, I actually placed my hands on the document at the end of this last one. That's like without a word. That's why his folders short. You might
maybe we can lean and see what the thing is.
Okay, that's what we're looking at. That's what we're looking at.
Hold it there, just
don't touch it.
Just leave it there? Okay, that's good. Make sure the camera's pointing okay to the people there. So
that's all right, we'll knock it over.
Yeah, that's a good thing.
They do need the ink on, but
get it all out of kilter. That's going to be a lot worse.
that'll be under the leg. Unfortunately, that is to the point right as you and me.
unpredictable.
You had snow on the ground.
She'll fit right in then.
I stayed with them since you.
That's probably a good idea. I thought about it.
I've never seen it. When we say I wish.
So, did Sarah Allen send you? I think we want to include you in the meeting, and then we're going to come down there, and then we're going to have back up here again on the 20th.
Okay.
So after the meeting, we're going to ethics meeting.
Okay.
If you can join us, that'd be fine.
Okay. Yeah, I'd like to. I told them I would like to go, but I didn't
Yeah.
initially.
Right, so what we're going to have it here, and then they could something happen. All of these comments or everything. 17th, I think we'll go. So, there's a level of setup, and now.
And you have the same chairs. I think I'm shorter in these chairs.
You're shorter? Yeah.
Actually, yeah, I'll look at my calendar.
The meeting was
Usually sit a
I
little
think
high.
they cut the legs off. Personal, taking it as a personal.
Well, those people but there used to be a lot.
But I don't think she has.
She'll send me some.
I'd like to call the meeting to order. First off, I'd like to discuss the charge of the work group, and I'd love to analyze the viability of mental health and disability service funding, including the methodology used to calculate and determine the base expenditure amount, the county budgeted amount, the regional per capita expenditure amount, and the statewide per capita expenditure target amount, and the cash flow reduction amount. The committee shall have recommendations to the General Assembly by January 15, 2019. With that being said, I would ask for approval of last meeting's minutes. So moved. Thank you, Representative Fry. All in favor? Aye.
Aye.
Opposed? Same sign. Thank you. We'll do opening comments. First off, I would like to thank everyone for coming out today. Obviously, the fog was somewhat bad in areas, but this is an important issue. I'm glad everyone's here. And I would just briefly ask to go around, and if anyone has any comments, please feel free.
Also like to welcome everybody, State Representative Joel Fry, glad you could be with us today at our second interim meeting, and I look forward to the agenda. We have a fairly rigorous agenda today with some of our folks out in the state of Iowa who are performing the duties that we've asked them to perform. So I'm anxious for their testimony as well as the Department of Human Services testimony on this topic. So thank you all for attending.
All right, seeing none. I would like to put out a few rules. I would like any questions to come through the chair as we're directing to our speakers if we could, and I'd like to keep it one question at a time so we can make sure we keep moving. When we get to the public comment section, we have 3 minutes per person, so that gives us 20 people. Currently we have 6, so we would ask that we stick tight, and we'll probably have a clock running on that 3 minutes. So I appreciate the promptness and everyone trying to keep us on schedule. So, all right, first up today, I'd like to have Rick Schultz with DHS to present the MHDS Region Statewide Report for SY 17.
Supervisor, if you would like some of the report up here on the screen with PDFs of each, if you want, that's up to you.
Okay.
They do have copies, so.
Okay, thank you.
Good morning.
Good morning.
Thank you for the opportunity to present to you today. And again, I'm Rick Schultz. I'm the Administrator for Mental Health and Disability Services for the Department of Human Services. And this is Teresa Armstrong. She's responsible for our Mental Health and Disability Services policy and implementation piece in our division. And we're pleased to be able to talk with you today and hopefully contribute toward your task in completing a report to the legislature. Our goal this morning is to provide you with a short snapshot of the Mental Health and Disability Services Region's financing. I would let you know that the regions put together an incredibly complex, comprehensive report to us each December. This year, the deadline for that submission, the first submission of that report is December 3rd. So we've only had the information for a few days. There's a considerable amount of information, and we need to have conversations with the regions to make sure we fully understand all of the data. So some of the information we'll share with you today is preliminary, and when we have conversations with the regions and we talk to them about what's in their report, there is some possibility of change. But we would tell you that we're very impressed and pleased with the quality of the data that the regions have submitted to us. So we're hopeful that there wouldn't be any changes that are significant. We're going to review with you the progress that Mental Health and Disability Services regions have made in developing core and core plus services around the state. And in doing so, because we've been gathering some of this information all along, we'll be able to share with you some information about where the regions are at in developing the services that were required to be developed in House File 2456. So if we'll start on page 2 of our presentation. Just by way of quick background, we do have 14 mental health and disability services regions, and they have very successfully developed not only core services, but they have been working on the development of what we have called over the years core plus services. The regions are responsible to develop a provider network of services regardless of where the funding comes from, but they are only responsible for funding services that are not Medicaid funded for individuals that meet their criteria. And those individuals in the law, it talks about individuals that have a mental illness or an intellectual disability at or below 150% of the poverty level, but the regions are allowed and authorized to increase that poverty level higher, and all of them, in fact, have done that somewhere between 200 and 250% of the federal poverty level. So, so they have a target population of folks that they're responsible to provide funding for, but the entire, in my view, all Iowans benefit from the work that the regions do in developing a network of services. The non-Medicaid services that we talk about, regions being responsible to fund, I describe them falling into two categories. One category are individuals who aren't eligible for Medicaid, and they're not covered by Medicaid. So the individual, him or herself, is not a covered person. The other side of the coin is there are some services that are not Medicaid covered. And so the regions would provide funding for those non-covered services. What we did, and at your direction when you passed redesign, is we worked together with the regions and with Medicaid to align as many services as possible, so as many services as possible are actually Medicaid reimbursable. So those are the areas that they're responsible for. I would say that when we started this journey on mental health and disability services redesign, and we came up with it, you all came up with a funding source and were very helpful in getting the region started and setting them out on their journey, just because of a lot of the circumstances that occurred. The biggest one of which was also expanding the eligibility for Medicaid. It turns out that at some level, particularly in the early stages, funding was a bit too high for the regions. Now, one of the things I want to point out is the fact that the regions had funding doesn't mean that they weren't working to provide services. I think that would be incorrect. Regions work very hard to develop access to mental health and disability services, and the data can demonstrate that. But the fact that because of the way in which they were funded originally resulted in them having some additional fund balances, which folks are now trying to work through, and we'll talk about that in a minute. So there have been some, most areas have developed fund balances, but not every region. There are some notable exceptions to that, as I think many of you are aware. The maximum levy for each county currently is determined by the total amount that the region's allowed to raise in each county divided by the number of residents that reside in that county, and that totals about $15 million statewide for state fiscal year 19. If you flip to page 3, in Senate File 504, the regions and counties were expected to spend down that fund balance that had accumulated. Otherwise, their levies would be forced to go down. And so the regions and the counties have responded. They continue to expand services, not only providing the core services, but also developing Core Plus services that we're building on today. And they've also lowered levies. And that's in a response to Senate File 504. The regions are now required to provide additional core services that you all passed in House File 2456 unanimously, and which we greatly appreciate. On behalf of the individuals in Iowa that are experiencing severe and persistent mental illness, this is a huge step forward, and we thank you all for your support in that. But that comes with an expectation for funding and under the regions. The original fiscal note, there was an expectation that the cost to regions in fiscal year 19 is $4.3 million, and in fiscal year 20 it could go up as high as $10 million. So that was reflected in the fiscal note for the bill, and that's what regions are working on right now. Now, that made some, I might say, some pretty aggressive assumptions about the growth of services. We're only 5 months in. It's hard to project how we're going to grow over the next 3 years, and so that these estimates are somewhat ambitious, but we'll have to see how things go in terms of the growth of new services. If you'll flip to page 4. This is preliminary information that we have gathered from the regions based on their December 3rd submission and some of the conversations that we've had with them since that time. And as I mentioned, we continue to evaluate this. We continue to have conversations with the regions. We will, if we misunderstood something or something was a little bit out of alignment, these numbers could potentially change. But as you can see on the left-hand side, obviously are the regions that are listed, the amount of audited fund balance that the regions had at the end of state fiscal year 17, the amount of revenue that they had to work with during that time period, and that revenue consists primarily of the levy that was raised, but not exclusively. There are some additional revenues that regions have that are also reflected in their costs. In some cases, there are some local folks that are helping some regions. There are some Medicaid funding in there. So if you look at that revenue and you compare it to what the levy was, you'll find that it's higher than the levy. But the reason for that is there are some other places that regions get funding for this. You will see then that the state fiscal year 18 expenditures of $112.7 million, and you'll see the resulting ending fund balance for state fiscal year 18 as being $121.6 million. We've also provided for you a percentage. This percentage is a percentage of the fund balance compared with the expenditures. And then next to that, for your reference, we have the amount of levy that the regions and counties have raised for state fiscal year 19 and the maximum amount of the levy. Recognizing that the way in which cash flows in the region and when the money comes into the region, I think everyone's aware that there's a need for a fund balance for cash flow purposes. You all can talk together and maybe talk with the regions about exactly what that amount is, but if you take an average, I think the current average is somewhere around, and I think the regions can give you specifics, but it's around $25.5 million that you would want to see to be able to cash flow through those first months when there's no revenues coming into the counties, into the regions. One of the things that I would want to point out to you as you look at this chart that we saw as we were looking at it, there are 4 regions here whose expenditures for state fiscal year 18 are higher than the maximum amount that they're authorized to levy. So if you look at community social services, they're spending, my chart is teeny tiny, so excuse me. They're spending about $20.6 million and their levy authority is 20. Eastern Iowa is spending 9.7 and their authority is 9.2. So you can see that there are some regions that are at some point in time, if that spending continues and is needed at that level, that's going to raise some issues. The other thing that we have been able to pull out in this is that just to recognize the work that the regions are doing. In state fiscal year 17, the regions spent, out of all of the spending that they made, they spent $75.8 million for mental health. They've got a larger charge than just mental health. So the bulk of the money they do spend is on mental health. They spent $75.8 million. In state fiscal year 18, they spent $95 million on mental health. So that, in my mind, is reflective of what the regions are doing to develop and cultivate services in their area. So that's a snapshot of what we know, and we're going to know more as we dig deeper into it. On page 5, we have produce on a regular basis what we call a dashboard. The goal of a dashboard, like your car's dashboard, is you should be able to look at the dashboard and know how fast you're going, how much gas you have, everything that you need to know in a quick glance. We don't exactly meet that expectation in our report. Our report is far larger than what you'd call a dashboard. There's lots and lots and lots of measures in that, and that's reflective of the amount of data that the regions provide us. But it gives us an idea of how they're implementing accessibility to core services, to the target population. It gives us an idea of how they're implementing Core Plus services, and now that's helping us in understanding how we're succeeding and moving forward with House File 2456 requirements. And but what I would point out, you have the dashboard. What you're going to see is some of the information, or much of that information, is old information. And what we will be doing over these next couple of months is replacing that old state fiscal year 16 and 17 data with fiscal year 18 data, and we'll be able to completely update the dashboard where it relies on our December report from the regions. So we're probably not going to spend a lot of time talking about the old information. I want to talk to you more about what we know that's current. But we will have, in the next several months, new information from the regions at a very detailed level. On page 6, of course there are some limitations to the data, and you can read more of those limitations on the actual report itself. But I mentioned that the data currently is old and needs to be replaced. And when it is replaced, even that information will be months old. It'll be from fiscal year 18, and so some of the data is going to be more than 18 months old. If it was actually done at the beginning of the state fiscal year 18, and we look at it, let's say in March, there's going to be some age to that data when we analyze individual utilization. It does not include Medicaid information. And we're just now getting to look at the data that's related to accessibility to core services. We have information related to core services, but it is also a self-report. We don't go place by place and do testing and those kinds of things to double check all of it. But we very much believe what the regions are able to report to us. But our conclusions are that the regions have obviously successfully formed, and we've talked about that before, and they've developed service networks, and they're meeting core service requirements for the most part. And where they're not meeting core services requirements, a big part of that has to do with workforce. Trying to find enough people to do the work in all of the areas of the state. And we have conversations with regions about what their challenges are in terms of workforce development. The legislature will be receiving any number of reports that it requested that the department submit this year. I've been privileged to sit on many of those work groups and to assist with the drafting those reports. And one very consistent thing out of all of those reports is asking what can we do to improve workforce development. And so when you see reports about tertiary care hospital, when you see reports about commitment, when you see the children's report, that's a very consistent theme, is continuing to work on workforce development. So that's an area that the regions find themselves in. And also, I've already pointed out that the vast majority of the spending for mental health and disability services is for individuals that have mental illness. Because lots of the individuals, not all of them, but lots of individuals that have intellectual or developmental disabilities become Medicaid eligible, and the funding is no longer the responsibility of the region. On page 8, I've already talked about the extent to which the regions are meeting core services requirements, And you can see that when you thumb through the dashboard and our colorful green chart that's in there, and the challenge that they have with workforce. The other point I want to make is what we're asking the regions to, information we're asking them to provide is not just do you have the service, but does the service that you have and have been able to develop meet the standards of access. So it's more than just having the service, it's having the service accessible. And the measurement of access is, in gross terms, is how long do you have to wait for a service, or how close is the service for you to get to. And so those have all been put in rules. So not only have we put in the definition of the service, but we've also defined access standards. So when we look at that, it's more than just does the region have the service. Is the service meet the access standard for that particular service? So we're going to go to page 9. I just told you a minute ago, I'm not going to spend a lot of time talking about old data, but as we flipped through the dashboard, there were some things that we wanted to bring to your attention. These are the things that we're going to look at when we look at the new data for the dashboards. I think this is some fairly impressive information. When you look at state fiscal year 16 compared to state fiscal year 17, and you look at the degree to which outpatient services are being provided for individuals that the regions are responsible for, and you look at the amount of inpatient that the regions are responsible for, what you see is what we're wanting to accomplish. We're seeing an increase in the amount of outpatient services per 10,000 people, and you're seeing a decrease in the amount of inpatient services per 10,000 people. And we use that number 10 per 10,000 as a way to be able to normalize the data that we have. And we use that kind of approach throughout the report. So, but this is data that we get that regions provide us that's individual by individual. And so we're going to look at the fiscal year 18 data, and I'm going to be very interested to see if this trend is continuing, because this is very positive. If you look at the next page, on page 10, you see a similar thing with integrated employment, and you see that between fiscal year 16 and fiscal year 17, that the amount of employment provided for individuals with mental illness in integrated settings increased, and the amount of employment that was provided for individuals in the congregate settings and shelter workshop settings decreasing. Again, a trend that we like to see, something that we want to see continue. And so we'll be looking at that, along with all of the other data that we have. So now we shift to the additional things that the regions are doing. And these additional things that the regions are doing, we are gathering more frequently. So let me tell you why we can do it more frequently with the programs and we can't with the other data. The data that I just showed you, the outpatient, inpatient data, the vocational data, that's all utilization. How many individual people utilize those particular services over that particular time. So in order to have that analysis, you have to have individual utilization data by the people that are served. And we only get that once a year. That's what we got on December 3rd. And that's what we'll do to analyze these points with the state fiscal year 18 data, because it gives us that information. What I'm going to go to now is a measure of programs. Well, you can measure programs regularly, and we work with the regions to gather this information quarterly. So it's not so difficult to find out if you have a program in place. It's a little more complex and a little more time consuming to find information about individuals. So that's the reason why there's this time gap and how that applies. So if we go to page 11, this is an area that both the regions and the counties are working on very vigorously on terms of jail diversion services. And you can see from the outset of mental health and disability services redesign how jail diversion services have grown in the state. We also know that many of our counties are participating in the Stepping Up initiative. We know that mental health and disability services regions are critical partners in those initiatives, and this is reflective of what they're doing in their local communities. When you look at these charts, one of the things to look for is on the chart on the left-hand side, always look for what is it that we're counting. So in this case, we're counting the number of counties that are participating in jail diversion services. And so you can see that there are currently 71 counties that are actively participating, and we've got 24 counties that are in development. We don't put in development in these reports unless the region can tell us what date they expect that service to be online and operating. So we kind of have a high standard for putting in development. It can't be just somebody thinks it's a good idea. It's lots of good ideas, but where are they at in the planning process? The other thing I do want to point out, because you would notice this, and you should, when you look at state physical in July 17, we had 17 counties, and now we have 71 counties. This is a reflection of our growing a little bit more sophisticated and making sure we know what we're counting. So in the earlier years, we were including services that were provided in the jails. Good services. And it is a reflection of some of the things that the regions do that are very helpful for people that you may not hear about day in and day out. But that's not jail diversion. It's an important service. It's not jail diversion. It's not keeping people out of jail. It's making sure that people that are in jail have the necessary mental health services they need. So we removed those from the data. And so it looks like we've gone backwards. What we've done is make sure that what we're talking about here, that when we present data to folks like yourselves, that we're saying something that we all agree on. So that's why you see the slight dip in jail diversion services for that period of time, not because we're going backwards. If we go to page 12, this is a busy little picture. I don't want to tell you how many hours we've struggled trying to figure out how to depict how we're doing with assertive community treatment. We've landed on this to give a real picture of what areas of the states are covered. Right now we have 11 assertive community treatment teams in 10 regions across the state, and House File 2456 has an expectation that we have 22 assertive community treatment teams that cover the entire state. The first thing I want to point out is for many, many years, Iowa had 5 providers and 6 teams. And in recent years, through in part due to the efforts of the regions, in part due to the efforts of the providers, that number went up to 11. That was a huge step, and that happened before House File 2456. 2456 now requires that we continue that effort. Each one of these little dots tells you what county is covered by an assertive community treatment team. And if you look very carefully, this is one of the hard things, you will see some of those dots are shaded in gray, and that's the areas that are under development. Southern Hills under development, South Central under development, Eastern Iowa under development in several of their counties. So you see that it's expanding. So we're going to be able to monitor this. And in fact, one of the things that we do in monitoring this is the new assertive community treatment teams that are coming on board. We kind of poll them every month and find out how many individuals are enrolled in those teams. to see how they're growing and see how they're picking up new people to serve. And where we see that they could grow further, we reach out and encourage folks to refer them to the assertive community treatment teams to receive those services. So this is one of the required services. This is where we're at today. This is where we know we're going right now. So we have several more in development. And our goal is to have one of those little circles in every county in the state. Mobile response is on page 13. Mobile response, there are 73, and this is counties, that have mobile response either already available or in the planning stages and a date set for when it's going to be available. I think this is another area that I think Iowa could be very proud of. When you think of the rural nature of Iowa and the challenges that mobile response has in a rural settings, to see 73 counties already in development for a mobile crisis, that's pretty amazing. And so we're making lots of progress in that area. And this is part of the array of the comprehensive crisis services that are now required by House File 2456. You can also see that 2456 is codifying an initiative that the regions have already begun. So, and this is as of September. These charts in terms of programs are as September 30th, and we gather this information quarterly. Page 14, you see another part of the array of crisis services, and that's 23-hour crisis and observation. And you see how it has grown over the years since Mental Health and Disability Services redesign is continuing to go up. You'll see in this case the number of folks that are planning on providing 24-hour crisis observation has declined somewhat. I attribute that to the Mental Health and Disability Services regions doing their planning, looking at what is best for the people they know in the counties that they serve. What are they trying to accomplish? And maybe we put our resources in 24-hour crisis, 23-hour crisis. Maybe it's more important at this time to move over to more of a crisis residential. So you'll see some shifts in planning over time. That's not necessarily negative. That means people are thinking about what's best for the folks that they're serving in their area of the state. On page 15, you see crisis residential services, and you'll see that it's continuing to grow over time. This now, look on the left-hand side, this is the number of beds. Because it's residential, we can count beds. These other community-based programs, they're happening in the community, and you really don't have beds, quote-unquote beds. So this is the number of beds. We think this is a helpful piece of information. They're designed to de-escalate and provide immediate services for individuals. And there are 13 regions that have access to these crisis residential, and they continue to grow. Let me tell you a quick anecdote here. Had an opportunity to talk with a sheriff the other day who was experiencing some challenges in getting folks referred to crisis residential services. And what I picked up from that conversation was his incredible support for what the region was doing in building these crisis services, and his encouragement of other law enforcement officials to utilize a service that they weren't entirely aware of and weren't, frankly, entirely comfortable with, because it's new, it's different, it's something. I've always taken people to the emergency department, or we've always had people go into inpatient psychiatric hospitalization. And here we have a sheriff talking to other law enforcement officials saying, no, you need to support this. This is there for you. This is going to be an excellent help to what you're trying to accomplish. So that kind of relationship is being built as we're developing these services. So this is crisis residential. Again, another part of the array of comprehensive crisis services that are required in House File 2456. I'll get the right number. The next one, while many of these services, we're not there yet, we're on a journey. We've got lots of growing to do. This is probably an area where we're more in our infancy than any of the other services. We have two facilities that serve 4 regions that have subacute residential services, and we've got many more that need to be developed. So this is an area that really we need to have some work on and more focused. A subacute facility is a comprehensive wraparound set of services for individuals that have a risk and have acute symptoms of mental illness, but they don't need inpatient services. That's the same in crisis residential. But their stay, they need a slightly longer stay than what you would ordinarily see in a crisis residential. I would say to you, in my experience, there is not an absolute bright line between what happens in crisis residential and what happens in subacute. Think of them as kind of an array of services that you can provide to somebody outside their home when they can't stay in their home. Sometimes, and the folks that are experiencing this probably can provide better anecdotes than I can, but sometimes I think of it in terms of someone who needs a crisis residential service, we're really focusing on their mental illness. That is the biggest focus. Someone who needs subacute, we're still focusing on the crisis and the difficulty of their mental illness, but we're probably also looking at other things that are affecting their lives. Housing, relationships with family, relationship with other people, maybe employment. There's other things that start coming into play on top of the individual's symptoms of mental illness. So subacute and crisis services go together very well and are highly complementary. And this is an area that we're going to have a lot of development in coming up. On page 17, we have the relatively new approaches to mental health service delivery that came out of House File 2456. This is intensive residential services. This is a very important service that is we're very much in need of in Iowa, and it is not a new service. It is a higher intensity of already existing services. We already have what we call our 1915I, some call it 1915I state plan service. It allows us to provide services for individuals with a serious mental illness that you wouldn't ordinarily get in Medicaid. And sometimes you hear the term, I hate this term, I use it all the time, but I still hate it. You talk about HAB homes or home-based habilitation. This intensive service is locating, finding, and coming to an agreement with a provider that is going to commit to serving individuals in their home-based habilitation that have some of the more serious mental illness symptoms, and be able to support them in the community. When you hear we need more beds, this is an area, it's not people living in institutions, it's people living with intensive support so they can be successful, and it's in community integrated settings. So we have one region that's developing this intensive residential service home, 9 that are actively planning, and 4 regions that are continuing to discuss. We are we're going to have to talk about how they get designated and how they continue to be supported and how they can be developed. So this is very much in its infancy because it is it's a new concept on an old service. So this is an area that we're working on. And then finally, access centers. probably heard a lot about access centers. And access centers, they provide a coordinated response for individuals, including individuals with multi-occurring conditions that have care coordination and provide subacute and crisis residential. So it's kind of like a commitment to provide a package of services. One of the conversations we've had with the regions, because they come up with creative ways of addressing individual needs, is do you have to have this access service under one roof? You know, we know we know where the front door would be for this service, but maybe it's located in a couple of different places. And the way that you passed the legislation, the way we were able to adopt the rules, that allows for that more creative approach, that you have a service that meets the access center requirements, but it's not necessarily under one roof. So I think that's going to make it easier, and it's going to accommodate plans that regions already have in place. They were already moving this direction. They were asking us, don't wipe out our efforts and make us start over again. Can you accommodate us? We're willing to meet the expectations, but we've got other ways to do it, and we want to continue to work with them on that. Again, this is for individuals with the most serious symptoms of mental illness, particularly during a time of intense need. 5 regions are developing access centers, 8 are actively planning, and 1 region continues to discuss. I would suggest to you that 5 months into the initiation of this, that's a lot of progress on a brand new concept that has been made. So, by way of going through the dashboards, the information that's in the dashboards that the regions are reporting quarterly, that provides you an update of where we believe folks are at in the progress toward the requirements that you passed last legislative session. On page 19, we share with you the outcome for success that we worked on together with the regions to try to measure whether or not we were being successful in these areas. And this came out of Senate File 504, one of the expectations in there. And we wanted to boil the items of success down to the most important things that we wanted to measure. So we have these 4 measures. How long were individuals in emergency departments when they didn't need to be? And we identified 24 hours. The number of individuals who are hospitalized beyond the time they should be discharged in psychiatric. The number of individuals that could have been diverted from jail. The number of individuals who involuntarily discharged from their community placement. So we thought that these were good measures. It has been a challenge for the regions to gather this information, because it really involves working with lots of other stakeholders. And so we still think they're good measures. And when you look at the implementation report that we submitted, you're going to see that we reported ranges, and those ranges were pretty wide. That's reflective of how difficult it is to gather this information. So we want to continue to work with the mental health and disability services regions and the other stakeholders, like the emergency departments, like the jails, like the hospitals, to see if there is a way to easily collect this information in the future. Because we think that these are the things that we've been hearing that are reflective of the need to build and improve services. And perhaps we should be collecting this information and see if we can get it. But it really is going to require more than just asking the mental health and disability services regions to do it. We're going to have to sit down with other stakeholders and see what we can accomplish. So that's on our agenda in the future, to see what we can do in terms of outcome measures. We certainly know what we call input measures. We're developing services. How is it affecting people's lives and what kind of outcomes is something that we still need to work on. The regions really did a tremendous job of trying their best to get this information. The one thing I do think that happened as a result of this is the continued development of relationships in the counties and in the regions between, and they've already had relationships, but this helped build them between the region and the hospitals, between the region and the emergency department, between the region and the jail. They had to talk to one another. You know, tell me how many people you had come to your jail that you think wouldn't have come to your jail if they had mental health services. And they could have that conversation and exchange notes and figure out what's needed in the region. We may not have come up with a highly valid and reliable number, but we did have a good conversation with the folks that operate the jails. Probably the last thing I'd like to say, and I almost forgot to say this, and that is, in this new move, the direction that we're heading now, another significant piece that I think reflects improvement in what we're doing is integrating mental health services with substance use disorder treatment. So when you see some of these new services, when you see intensive residential services, we expect that one of the requirements for an intensive residential service provider to be able to provide substance use disorder treatment or have ready access to substance use disorder treatment. When you see an access center, one of the expectations is that the access center either provides substance use disorder treatment or has ready access to substance use disorder treatment. So another area of collaboration is we are working with the Iowa Department of Public Health on a statewide call line. That's our responsibility that we need to work on and develop, but we're working on doing that so that it is merges with and is part of the call line that's related to substance use disorder treatment, suicide prevention, and other things. So this building together the response to people with the most severe complex needs and to include substance use disorder in all of that discussion is, I think, a very positive step forward. So that was our attempt to provide you a brief overview of the financial situation that the regions are in based on our brief analysis of their reports, a review of what they've accomplished in the development of core and core plus services, and an explanation of where we find ourselves in the last 5 months of development of requirements in House File 2456. With that, Mr. Chairman, I'll stand for questions.
Thank you, Mr. Schultz. We have Senator Holcomb.
Thank you, Mr. Chair. Rick, thanks for being here. Thanks for your report. This is obviously a lot of data. On the bigger report you didn't talk about. You talk a lot about data and collection of data. It concerns me. I have concerns about whether we have the system in place to collect the data that we need. And in one of the limitations you note here, it says the regions do not report all information consistently. Number of people funded is not yet reported in a consistent manner. The use of funds, that's one thing, right? How many people? And as we talk about the funding, which I think is the charge of this committee, in terms of like figuring out a sustainable funding source for mental health services, it seems like it starts with having a better sense of the populations and the numbers. And so, can you talk about? I know the county has an information system. I don't know if that's where we draw data, but are people collecting data on individuals served? And do you have any? We walked through additional things that are happening. And you talked about jail diversion, community teams, mobile response, and we talk about it in terms of how many counties are doing it, how many more might. But do we have numbers of people that have been diverted in those counties, so that we can assess what the cost of adding jail services are? Because as we look ahead to the complex needs stuff, it's like we've budgeted 4.3 million this year. We've budgeted 10 million next year. And we don't, I mean, it's hard to even have any sense without a better data set what the financial needs of this system are. So talk about our data collection system, how we're going to get regions to consistently report data, and your capacity, both by way of hardware and personnel, to actually get a more detailed picture of this. Because we seem like we're kind of in the same place here on understanding the population. On page, I think, 3 of the report, it says, this is the only place I see a number, a total of 30,161 unduplicated individuals are in the system, 30,000. And that's the only place I see, I think, in this, any like people like the numbers. And I think if we want to put money to this, we've got to have a better sense of who's in, what's the growth, we're going to add services in these various categories. What's the body count? So can you give us a better picture of like your ability and the department's ability to manage a better information system in working with the regions?
Well, first let me say that the consistency and ongoing reporting from the regions improves every day. We meet with the regions monthly. One of the regular agenda items, maybe not at every meeting, but a regular agenda item, is to coming to consensus on how and what to report. The regions are highly cooperative in those discussions, and so that whole issue improves every day. So we're seeing improvement on that, and we are pleased with that improvement. In terms of our capability, we have the capability. We have enough hardware, we have enough staff to do the analysis, and ISAC and the regions do have a data system, and that is where the vast bulk of the data comes from. So we cooperate on how we use that data. I apologize that it's way in the back, but you might want to look on page 30. You can then see the amount of money that's being spent for each population. So that's another, when you say how much money is being spent for what, that's another reflection. We can also show how much money is being spent for each service. So we can slice and dice it in a variety of ways. And I would think that, and we're improving regularly on the accuracy and consistency of the data. And some of it is just very hard. Could you think of an example of what's of a hard one to nail down?
Well, I think what is hard to nail down is, and this is one of the things that you said, was jail diversion. So who are the folks that are being diverted from jail diversion, or folks that got a service and did not have to go to the hospital? That's hard to get in this type of data. We can't do that, but regions are collecting that. So as we move down the road and we're able to more consistently be able to get that from every region, if part of when regions give us this data on December 3rd, they also gave us large reports, written reports, and many of them included that type of data within their reports. You know, how many folks got mobile response and did not have to go to inpatient psych.
So I appreciate there's ongoing conversations. Ongoing conversations at a meeting isn't a set of required things to report. Do you have a system in place that the regions gather on the community action teams? How many people is every region supported that has? I think we only have 36 counties with action team with the community teams. Do we know how many people are in that system?
Yes.
And is every county, once we get that up and running, is every county going to tell us that?
Yes, they are. And
is that a formal agreement? I mean, how is it more than just an informal discussion?
Oh, no. The informal discussion it's not an informal discussion. Okay. It becomes very formal. We agree on how things are going to be reported, and that's how they're reported from there on out. And if there needs to be specific changes, then those changes are made. But let's start with the vast bulk of the information we get is about an individual that received a clearly defined service. When there's some areas where that's a challenge, but the vast bulk, we are getting data from the regions, very specific data about very specific people, about very specific services. It has many of the same characteristics that the Medicaid Management Information System has. And we can just go in there and say, for that region, how many individuals did that region pay outpatient therapy services for? I just picked that out of the air. And how much did they spend on outpatient services? How many people were provided those services? How many encounters were there? There's a significant, large amount of data that is solid and is individual specific, and they do share that with us. And in areas where we have difficulties, we formally agree on how we're going to report it from there on.
Great. Thank you, Rick. Thank you, Mr.
Thank you for your question, Senator. Please address through the chair so we can get through everyone's questions going forward. Senator Fry, you're next on the list. Or excuse me, Representative Fry.
No problem, thank you. Thank you, Rick, for being here today to share with us this presentation. I'm looking at your presentation page 4. That's the spreadsheet.
Yes.
And when I look at ending fund balances for 2018 of 121.6, I look at the actual 19 levy amount of 72.7 million. When I add those together, I get, I think, pretty close to 195 million. If I add the funding 2018 fund balance of 121.6 with the max 2019 levy of 114.9, I get a total there of 236.5. When I look at the actual expenditures of 112.7, and I go back to page 3 and I see the fiscal year 19 and 20 requests of 4.3 and the 10 million, I'm having a difficult time in my mind figuring out where the lack of money, according to this chart, is in the system.
I think what in the system today, there's only a small number of exceptions where there might be some challenges in certain regions. There's money, and the regions are working aggressively to spend that money on core services. I think the question that arises is a question of what happens in the future.
The other thing I think if I may, Mr. Chair. The other thing I just heard you say then, I think, is that within that context, the question is what pockets of the state then are potentially struggling versus other parts of the state that are well funded.
I think the answer to that is yes.
Thank you. Do we have any other questions? Representative Carlson.
Thank you, Mr. Chair. A definitional question regarding slide 10, where you have individuals with mental illness and their vocational services. I'd just like to understand that definition. When I look at some individuals in Sheldon Works shop, some of them have mental illness, some of them have mental disabilities, and some have severe physical disability. Are they all incorporated in this statistic, or is this statistic exclusively those who are diagnosed with mental illness?
Just individuals with mental illness.
Thank you.
Thank you. Next up, we have Senator Seabar.
Thank you, Mr. Chair. Thanks, Rick, for being here. I come at this as an Old County supervisor, which I think everybody knows. The regions, and I was against going to the regions in the first place, but have since changed my mind. I think we did the right thing. If regions are planning and setting up these new core services, is there a mechanism where they could charge what they think they're going to spend against that balance that they're supposed to spend down? Because I think there's a fear out there that we're just going to have to get rid of that money and spend it, and we don't want our taxpayers who have allowed us to have this balance in the first place to tax them again. And one of the principles of county property tax was, at least in our county, was to keep that as even as possible and not make big sweeps up or down when you're doing your levies. So Is there a mechanism that they could charge, if they figure out what that's going to cost them, that you can charge that against your balance so that you can keep that on hand and not necessarily spend it actually in the fiscal year that we're trying to get it spent down in, but keep it in reserve so that you have it available to set that function up later on in the process. Understand the question?
I think so.
Okay.
And I think what I'm hearing you say is you're talking about like an encumbrance. Yeah, I'm going to spend money in, let's say, fiscal year 2021, and so I know I'm going to spend that money in 2021, and so I want to be able to say, put that in my term from an accounting perspective, an encumbrance on it. And I think that's a question better put to the people that do the fiscal accounting. I don't know the exact answer to that question.
My banker asks me the same question all the time. Thank you very much.
Thank you. Okay. Representative.
Thank you, Mr. Chair. Rick, I know that we had had a conversation several months back in regards to some discussions with the counties to pay beyond the base rate for services. Are there any still discussions going on? Because I know there's been kind of conflict of whether that is supplanting or supplementing Medicaid and whether that is allowed or not allowed. Can you tell me or provide me an update on that?
Sure. That's frankly something that in one particular service has been happening, and there was some fear that, and the fact that it was happening, that was not allowable. And in fact, we had legal review, and it is allowable. So the service that I'm referring to is assertive community treatment. And the legislature will be getting a report here shortly that talks about what does it cost to provide assertive community treatment. And clearly it costs more to provide assertive community treatment than the established Medicaid rate that's been established for quite some time and hasn't really changed. And those programs only survive because the regions have been helping them. And they've been using block grant funding. And in review with our legal counsel, they believe that there is nothing wrong with that as long as we do not charge a Medicaid recipient. The Medicaid recipient is the one that has to be protected. If there is additional funding for a Medicaid service, Medicaid really doesn't care, but they want to protect the recipient. And as I reflect on that over my years of experience, and I know this is slightly different because it's not government funding, but I was fortunate enough to be able to work for years in an organization that committed lots of funding to the individuals that they served, well above what Medicaid paid, and they got all of their money from charitable contributions. And so they could use charitable contributions to add to the funding that we got from Medicaid. Now I know that's not the same as having property tax levy do it, but when they looked at it from a legal perspective, there wasn't anything to prohibit it. But it also is not something that is required. It is something entirely up to the region.
Okay, thank you. I appreciate you stating it's not required, because that would be something I would have a concern on, is when we're looking at fund balances that counties have, or limited that they have, if that becomes a requirement, these figures are definitely going to drop down, and how do you sustain or how do you build capacity for any new services within the region? So for me, I'm just going to be mindful and watching that, so thank you.
Okay, thank you. I think I'm next up on this to finish out the first round. I would like to know what is our Medicaid total dollars going to mental health treatment that is being reimbursed back to regions and or others?
That's an excellent question, and we're just on the verge of being able to give you that information. I don't have it for you today, but we are in fact developing that right now to reflect the total amount contributed toward mental health.
Thank you. Representative Fry, you're up on the next.
Mr. Chair, thank you, Mr. Chair. You're on. I got you on the list. Rick, this kind of moves us away from financials for just a minute and more to the access team or access center conversations. Do we know yet on a map where those access centers potentially are going to rest? Because I'm very interested in geographically making sure that those access centers are well placed throughout the state and not clumped together or only in metropolitan areas, but that we have equal access across the state geography-wise.
I'm going to let Teresa talk to that.
The regions that we know are doing them right now, and the first one is the Cross region, so that does not have a metropolitan, so you know where that's at, don't you? But then we also have CSS, Northwest Iowa Care Connection, so that's up in the northwest part of the state, so that's not a metropolitan area either, and Southeast Iowa Link down in the southeast part of the state. So what we know that regions are doing, when Rick talked about, kind of like it's not necessarily the building you report to, I think that's helping our smaller regions to be able to say, I can do all of these services kind of under the umbrella if they're not sitting in the same building and still be able to meet all the standards.
Senator Bolton.
Thank you, Mr. Chair. I wanted to follow up on Representative Fry's questions about it appears there's a sufficient amount of money in the system right now. And, we changed the law to try and get after some of the ending balance spending. But it occurs to me, and Senator Segebart's point is, taxpayers want, and county supervisors, want to have kind of an even levy for their taxpayers, maybe going down, right? But we have 14 counties that did levy for their MHDD services in an attempt to address, I think, the concern of the state to spend ending balances. And it's been, I think one of the challenges for this committee is trying to look ahead to say, what is the cost of access centers? What's the cost of these teams that are going to go out and help people in crisis, subacute beds, intensive beds, looking forward, because the ending balance is one-time money, theoretically. And you spend one-time money on the development of a new access center or new services, and then you run through that money, you're back at your levy. So I think one of the challenges is trying to give the regions, I assume the regional administrators are struggling with what is the cost of trying to meet the complex needs goals in terms of services. And it's hard for us. I mean, we don't want people stockpiling taxpayer money. We want them to spend it on services, but there is a rub here in terms of our desire to push that money out and get it spent, but make sure that as people do it, there's some assurance to those providers that there's going to be resources to fund the services that we've built up. So I don't know if you want to react to that or Representative Fry on that. I don't know. Just that's really the big question about what the levies should be going forward and what money. And I think the estimate we have of $10 million in 2020, that might be just counties aren't moving ahead fast enough, but the notion that we're going to implement all the complex needs legislation around the state with all this new capacity for $10 million, I don't think that's real. I don't think you do either, probably.
Yeah, point out that the single largest, in terms of the estimate, the single largest pieces of that estimate that would become the region's responsibility is between the assertive community treatment teams and the crisis residential. And that's because when you develop an assertive community treatment team, you're bringing 10 professionals together to provide a comprehensive community-based response for individuals. And on the first day that they come to work, they don't have someone to serve yet. So somebody has to pay the salary for that first day at work and for the second day at work. And maybe by the end of the first month, they might have 5 or 6 individuals enrolled in their program after they've gotten themselves organized. And so that's an intensive startup cost. And we kind of projected that it would take at least 10 months to bring that team up to a full membership and be able to operate. One of my goals is to constantly express impatience. They're not growing fast enough. They're not enrolling people fast enough. Why aren't we finding people to get in these teams so that the cost of startup can be reduced? So that's, and the same with crisis services.
Thank you. We have one more question. Representative Carlson.
Thank you, Mr. Chair. As we develop this additional capacity in the state, when you look at the geography of some of the regions, you know, are we encouraging the regions to work together because the access time as well as the cost to provide the service may be closer in some cases to go to an adjoining region and still be efficient and effective in the deployment of the service and also the expenditure?
The short answer to that is absolutely. And in fact, in the legislation that you all passed last year and the rules that have been adopted and working with the mental health and disability services regions, well, first of all, the regions working amongst themselves. They have organized themselves around working together and being able to work across boundaries. And when you passed the legislation last year, it was different from the original legislation. The original legislation said every region must have access to every one of these services. It held every region responsible individually. Now that we have some of these more expensive, more complex, more intensive services, it talks about regions working together. And they have been working together, and they in fact will continue to work together.
Thank you. Are there any other questions? Thank you very much for your presentation today. Next up, we have Lori Elam, CEO of Eastern Iowa MHDS.
Good morning. Thank you for inviting me to speak. My name is Lori Elam. I'm the CEO of the Eastern Iowa MHDS region. That includes 5 counties, Cedar, Clinton, Jackson, Muscatine, and Scott. And we have a population of about a little over 300,000. We're on the far eastern side of the state. So I'm going to shift gears a little bit, and we're going to narrow your focus on what I'm presenting today. I was asked to come and present on our region's specific issues and our struggles. And so you have a document in front of you that I've kind of highlighted some pieces. There'll be some repeat language and some slides from what Jess presented at the October meeting regarding Senate File 504 and House File 2456. And there could be some similarities from what DHS just presented as well. So I'll go through this quickly and then allow for questions. So our region is facing fiscal challenges, primarily because of Senate File 504 and House File 2456. And I'll give you specific details. The regional cap, our regional cap, is $30.78. So when all 5 counties are at our max levy, we generate $9.2 million as a region. Our region has a deficit budget in just meeting current service needs. In just a few minutes, you'll see the slides showing our budget. The board, the governing board for our region, as well as the management team and myself, we have concerns about the cost of new services from House File 2456, how to pay for them, but more importantly, how to sustain them. So in FY17, the legislation passed, Senate File 504, had a significant impact. It created new regional caps. So those regional caps range from 2584 up to 4728. And it was based on FY15 expenditures. And we were only a region for 1 year at that point. And many of us didn't have crisis services developed, particularly in Eastern Iowa. We were just starting. We have a significant contract with Robert Young Center to manage our crisis system. So they're expanding that, but we started off slow because one, workforce, and two, we wanted to make sure we had the right services in the right place at the right time. So again, our cap is 3078. With Senate File 504 and that new regional cap, 4 counties had to reduce their levies to 3078. So that caused a reduction in revenue of $2 million going into FY18. Scott County, within our region, could have increased our levy from 1930 up to 3078, but the Scott County Board chose not to because they immediately identified additional revenue or fund balance was not necessary given the current mandate of Senate File 504. We had 2 years to spend on fund balance. Why would we add $2 million to our fund balance and make it even more of a challenge to spend that down? So at the end of FY17, right after Senate File 504 passed, we had a fund balance of $13.9 million. There was no way we needed to add $2 million to that. So Senate File 504, it altered the tax levy authority, and then it also required fund balance reduction. And fund balance reduction very, very quickly. So our region was one of the 14 regions, as Senator Bolcom mentioned, 14 counties had levied 0. 4 of those 14 are in my region. So also impacts with Senate File 504 that are causing some angst for our region is the requirement to be at 20 or 25%. Our region is over the 100,000 mark, so we have to have a fund balance of 20% at the end of FY20. And it's not just our region has to be at 20%, every single county has to be at 20%. So we are working very quickly and putting a lot of pressure on our providers and needing to spend money and spend it fast. And that's just very, very difficult and causes a lot of heartburn for our entire region. If we don't have according to Senate File 504, if we are not at the 20% mark at the end of FY20, then our levy will be reduced by that same dollar amount in FY22. So we're losing local control in regards to our levies. I do want to talk just briefly about the financial history from state funding. And I believe Rick mentioned this when he was talking about money that went to the regions. FY14, we weren't a region yet, but we received a significant chunk of fund balance. It was that 4728 and several counties lowered, several counties were brought up to 4728. In FY15, our region received equalization dollars also. In 16, there was no state funds to the regions, although our region did receive a grant of $500,000 because we were having difficulty and we weren't sure we were going to stay together. And so this was done by legislature, very appreciative of that money to keep us, making us promise that yes, we're going to work together, we're staying together. We've come a long way since FY16. FY17 and 18, there was no state funds. So when you look at our levy history, just for our region, you can see in FY15 in the chart you have in front of you, the per capita for each county varies anywhere from 1960 up to 4728. It created the property tax revenue of 9.1. Our expenditures were 9.9. In 16, again, we were all over the board. and our property tax revenue was 8.6, and our expenditures 9.8. I want to jump forward to FY18. You'll see where everybody lowered to the 3078 except Scott County. It created the property tax revenue of 7.2, and we spent 9.7. So we are eating up our fund balance. In FY18, we provided $1.3 million in grant money to a variety of providers to enhance supported employment, to enhance mental health court, and to improve peer support, peer drop-in, a peer respite. So we brought providers together and said, okay, we have this mandate, we have to spend fund balance, we want to make sure we're doing the right thing, but then we need to do it quickly. And so, is that a good business practice? No, it was scary, and $1.3 million is a lot of money. We do have some great providers in our communities, and they're doing good things, and they're sending us quarterly and monthly reports on how that money's being used, how many people are involved in supported employment, how many people are being served under mental health court. They're reporting that data, and I'm sharing it with the governing board, but it's still very scary. And they know it's only one-time money. So next year, that money won't be offered to them, and they have to figure out how they sustain those services without our help. In FY19, the year we're in right now, you'll see that we have 4 counties levied 0. Scott County did raise their levy slightly just because we wanted a little bit of revenue coming in. And so we're anticipating with our expenditures at $15 million, because we're expanding the crisis services, that we will end up, if we spend every dollar, which all of you know we never do, if we were to spend every dollar, we would have a fund balance of $1,100,000. So we've gone from 13.9 to 1 in 2 years, which is really scary. And when I start thinking about the new services from House File 2456, the Access Center, the Intensive Residential Service Homes, our ACT team, we have Vera French Community Mental Health Center who's doing our ACT program now, but they're expanding to the other 4 counties. They're doing wonderful things, and those services are awesome, and we want to have them in our communities. But I'm having a hard time figuring out and being able to convince our providers, how are we going to sustain this? How are we going to continue to move forward? Because all of you know it's not good business to start a service and then a year later cut a service and then start and stop. We can't do that. FY18, and I've mentioned House File 2456 several times, you know, it's better serving these folks with complex needs. I know a handful of individuals in our communities that bounce from jail, hospital EDs, homelessness, jail, back and forth, and it's expensive. It's not good care, not good treatment. They're not on medication consistently. They're homeless. In the winter in Iowa, being homeless is really scary. So I embrace this legislation. We just have to figure out how we're going to pay for it. So you'll see on the page, the slide with the expanded core services, as Rick mentioned, you know, we have budgeted for 19. Our mobile response, right now we have it in 1 county, in Cedar County, because they don't have a hospital, but now we're expanding it to the other 4 counties. So we'll have mobile crisis in all 5 counties. By the end of 19, our law enforcement agencies are ecstatic, because they continue to get those suicide calls, they continue to get the calls from individuals who are having problems with their medications and they just don't know what to do. And that's not good use and good resources for law enforcement to do that. So the mobile crisis is going to be welcomed with open arms. We also are investing dollars in crisis stabilization residential services, having homes in 3 of our counties, Clinton, Scott, and Muscatine, and that way Jackson and Cedar will have access as well. But these will be places that people can be taken to by mobile crisis or law enforcement, because they don't need hospitalization and they definitely don't need to be put in jail. They've not committed a crime, but they can't stay in their current environment because it's a crisis situation. So as I've mentioned before, House File 2456, we have several new services that have been mandated, and we also have 3 brand new services that are very expensive 24-hour type services. And all of those have to be implemented on or before July 1 of 21. And I mentioned earlier, the region did help Vera French expand their ACT program by providing a little over $300,000 in 19. And I know we're going to have a discussion with Vera French and the governing board because they will need money going forward as well. So budgeting for FY19 was a bit of a challenge when we had 4 counties levying 0. And we also had Senate File 504 requirements, and then we knew House File 2456 was also adding requirements. We continue to have a contract with Robert Young Center to develop and expand our crisis services, and this current year it's $5.3 million. At the end of 19, we, again, as I mentioned, we project to end with a fund balance of about $1 million. And again, if we spend every dollar, we will have met the 20% goal or requirement from Senate File 504 a year early. And this was all done because of 4 counties lowering 3078 the year before, so reducing our revenue. We had then 4 counties levy 0 in 19, and then we've increased our expenditures, additional crisis services, the ACT program, and the one-time funding grants. Now I will share with you, I work very closely with our fiscal agent. As of October 31st, 18, we have already spent $4.7 million. And we're only 3-4 months into the year, and we only have brought in or collected $2 million in revenue. So if we continue at that pace, we will hit that $15 million budget mark fairly quickly. So our issues, I've mentioned the 2 bills forcing us to reduce fund balance quickly. We've been developing and implementing these new, very expensive 24-hour services, all really good services, not opposed to that at all. One problem that we have is we have bouncing county tax levies, and I don't know if our citizens are aware yet. They may have seen their tax bill for 19 that it's 0, but when they see 20 and we're all at 3078 or somewhere above 0, I'm sure that our boards of supervisors are going to be getting calls. And I don't know if that was necessarily the intent of Senate File 504. I don't think that was. I understand we don't want regions sitting on large fund balances and sitting on taxpayer dollars, but it does take time to develop services, and we want to do them right. We don't want to start something and then have it fail. And bringing providers together takes time. Hiring staff, finding staff takes time. And then the training piece of it. It's very difficult to sustain services when our cost of doing the services are exceeding our available revenues. So in summary, the planned decreases of fund balance is fine and easy to accept, but long term, we can't withstand always having a deficit budget and move forward with the mandates from House File 2456. It's not good business practice to use fund balance. You all know it's one-time funding. And our current operating budget, if we looked at just current services without doing any big expansion, it would be about $13 million. So even at the 3078, we're not going to make that budget. It becomes a challenge with our providers when they know what revenue we're bringing in, and they see the budget, and they're looking at me like, how are you going to do that? And we all know we don't have trees that grow money, and we can't print money, and so I have to figure out how do we move forward. All of the services are fantastic. Our region has done a great job. All of the regions have done a great job. As you've heard DHS say, we want this to work. We want these new services. We want people taken care of, but it all comes at a cost. So, I guess I'll open it up. If you have any questions, I'd be happy to answer them.
Thank you, Lori. Really appreciate you coming in today and helping navigate through some challenges that we face right now with MHDS regions. Representative Rob.
Thank you, Lori, for coming to present to us today. Not all regions took the approach you all took. And certainly not all counties zeroed out the levies.
Right.
And so I'm left wondering and struggling with why, in total, that was done within your region. I hear some of the rationale now as you presented today. But because not everybody in the state took that same approach to spend down their fund balance, give me better rationale, more clarity as to that rationale that you all chose. And then the other piece of that is I also wonder, I know your region's had some of its own internal conflicts over the years. I've been around long enough, sat at the table with you long enough to work through some of the other issues in years past. How much of that is playing into the decisions for some counties to zero out and Scott County to continue to have a levy?
You know, our region has definitely had its growing pains over the last 4 or 5 years. And after Senate File 504 was passed, the governing board met with our fiscal agent, who is also a CPA, and he said, okay, there's multiple ways to look at this. You can decrease revenue, increase expenditures, or do a combination thereof. So we pulled all of the supervisors from all 5 counties together, and he went through the bill, Senate File 504, and laid out what needs to happen. And we talked about, you know, if we lowered levies, and then if we did this, if we increased levies, and he went through 3 different scenarios. And when we came back with the budget and the services, it ended up being a combination. Now, I know that there were some counties within our region that were upset with Scott County for not increasing to 3078. It's very well known, and we had a very heated meeting a year ago, November, about the levy issue, because Scott County supervisors and myself were here talking to many of you saying, give us the opportunity to raise our levy and we will do it. But with Senate File 504 came that other arm that said you have to reduce fund balance or we will come in and tell you what you're going to levy. That played into the fact of we can't increase our revenue because we have to spend this $13 million and we have to spend it fast. So, you know, it was a difficult decision for the Scott County Board. I know that some of the boards from the other 4 counties were very angry with Scott County. And we had a meeting, like I said, and people vented. And it was not a pleasant meeting. I was up front with our fiscal agent, and we got hammered. And okay, now it's in the past. We're moving forward. We've rebuilt that trust. I do have a supervisor here from our governing board from Cedar County who can talk about some of that angst that went on. And I think we've worked through it. We have great services, we're expanding. So it was a challenge, but House File 50 or Senate File 504 had 2 pieces. If it was just you can raise your cap up to 3078, then we probably should have done it, and maybe we would have. But because there was that other requirement of spending fund balance down to this mark, we had to do that. So I hope that answers your question.
Thank you, Mr. Chair. Thanks, Lori. Thanks for all your work. It's been a challenging time, but I appreciate your long service. What do you think the ending balance needs to be for Scott County to meet its cash flow requirements with tax collections coming in September of the year, and the fiscal year starting on July 1st.
Right. Well, this current year, as I mentioned, at the end of October, we had already spent 4.7. 3.3 is about 20%. So I would say anywhere between 3.5 and 4 would be an appropriate amount to get us through the first 3 months.
More than 20%.
Yeah, probably closer to 25.
Okay, thank you. In general, I think the county, we've thought about this as about a 25% ending balance to cash flow. I mean, just rule of thumb. And I don't know where the 20% came. I don't know. That was who came up with the 20%. It got passed into law. Here we are. I wonder if Scott County in this particular region isn't really the canary in the coal mine, in that we're going to see if there's a concern of counties levying zero, and then suddenly spending the ending balance and taxpayers being whipsawed and providers being worried about, they do know what the budget is, they do know what the levies are, because on June 30th, 2020, 18 months from now, the budgets that county supervisors are working on today, they have to spend all this, they have to get down to 20% ending balances. So I think there's a really good chance that we're going to go from 14 counties levying zero as they prepare their 2020 budgets, just like we're going to do when we come back in January. We're going to see a whole bunch of counties that are going to feel like they're going to be penalized unless they don't deal with what the state handed them. So I think we're going to be in a rough spot with these counties come next year with these budgets. This committee meets again next year because we don't report until December of 19. I think, Representative Fry, we're going to see if people are concerned about, notwithstanding the challenges of people getting along over in this region, we're going to see a whole bunch of counties levy zero in order to meet this. I think we should take a deep breath and rethink this ending balance issue. Obviously, we don't want counties to stockpile money. If they're levying, it ought to be spent. Taxpayers have a right to see that happen. But maybe a better approach would be to require each of the regions and the counties to earmark or to designate how they're going to spend that money with a longer horizon. I mean, it was pretty short, as Lori indicated. It takes time to get services up and going, and maybe our dismay with the regions and the counties for building this balance, we wanted them to move quicker than it's really reasonable or they're able to do it. So I wonder if we ought to take a look at this year and rethink this and encourage the regions and the counties to planfully look at those ending balances. One-time money that we don't want spent on ongoing things. That's one of the budgeting principles in this building. But give them a plan where they can come forward and say, well, we've got 80 million in ending balance, and over the next 5 years, we're going to program in these ways to implement what the state needs on these mental health issues around complex needs. Just a thought. I just think we've kind of put the gun to folks' heads on this. I just think there's some unintended consequences that I think we're on the doorstep of with this region right now. Thank you, Mr. Chair.
Thank you, Senator Bogo. Is there anyone else on the first round of questions? If not, I'll go back to Representative Wright.
Just to follow up into the discussion we were having, would it be anticipated that the 4 counties at zero would be raising their levies in fiscal year 20?
We actually had a strategic planning session yesterday with our governing board, and we talked about the levies, and I think there was consensus that we all know we're going to have to increase, whether 3078 is the right amount or somewhere close to. Our fiscal agent provides the governing board every month a financial report that shows the breakdown of cost per county, plus the breakdown of cost for our crisis services. And if you add those $2 amounts up per county, you can kind of see where they need to levy. And it was very, very close to 3078, or actually more. So, we'll have to adjust from there.
Thank you.
Thank you.
Next up will be Kathy Lerma, CEO of County Rural Offices and Social Services, otherwise known as CROS. Thank you for coming in today, Kathy.
Thank you. Thank you for having me. I have to push the button all the time?
No, just push it.
Just once?
There you
Okay,
go.
sorry. Thank you for asking me to come and talk about the Cross Mental Health Region. And I wanted to start just giving a little bit of background information about Cross. We are a 7-county, rural counties region. We are comprised of Clark, Decatur, Lucas, Marion, Monroe, Ringgold, and Wayne counties. We have a total population of 78,676 people. Our maximum per capita levy rate currently is $39.13. In this fiscal year 2019, all of our member counties are levying at $39.13. Our fiscal year 19 estimated maximum levy amount is $3,078,592. One of the distinctions of our region is that we are comprised of 5 member counties that are below or higher than the state poverty level. Decatur County, I believe, is the poorest county in Iowa, and according to Wall Street, we also, Lamoni, which is in Decatur County, is the poorest town in Iowa. So, so poverty is something that impacts our region quite a bit. And then some highlights within our region. We began the first Assertive Community Treatment Act program in Iowa. Our program covers all 7 member counties. In the second year, Cross allocated 10 of our 50 client slots to South Central Behavioral Health Region, allowing the team to expand into Appanoose County in that region. The team currently has all 40 client slots for Cross filled, and 5 of the 10 slots for South Central Behavioral Health Region are filled so far this year. We have plans for an access center. We did an RFP last fiscal year and awarded that RFP to Community Health Centers of Southern Iowa, which is a federally qualified community health center. The access center will be opening November 1st, 2019. Our vision for the access center is a little different than what the legislature put in place, but we had a reason for that. As with all the regions, when Senate File 504 came out, we had work groups throughout our region. We had Iowa State University come down and help us put together a community action plan related to the 504 and Senate File 2456 requirements. So, and from that, what we gathered was that given our how rural we are, the limited amount of professionals, mental health professionals we have within our region, we needed to bring our services under one roof. We needed to maximize the capacity of those professionals to work within those services. So that's why we came up with the model that we did for our access center. So in our access center, besides assessment and evaluation, we will also provide medical clearance there. We will have 23-hour hold, 3 23-hour hold beds. We will have crisis stabilization residential services within that access center. We will have 5 beds for that. We will have 7 subacute beds. We will have peer support warm line and peer support counseling services available within the center. We will have mobile crisis to all 7 counties, and it will be linked with our access center. Our access center therapists who will be on call will be available to the mobile crisis team, probably through iPads if we can find solutions for having internet access at times when needed in the rural area. Crisis stabilization community services will be phased in year 2 of operations. through the Access Center, and then Access Center will also have care coordination available in it. So it's a little bit expanded version of what was in the legislation, but we feel it will serve our region very well. I'll go back to it a little bit later. I want to take you to page 3 in the handout I provided and walk you through the financial projections for the next 5 years for the Cross Mental Health region. In fiscal year 17, you will notice it was prior to the passing of Senate File 504. All member counties at that time were levying at their maximum levy amount for that fiscal year. So at that point, our region tax revenues were around $3,191,285. In column B, fiscal year 18, Senate File 504 created regional per capita levy caps, and it was implemented at that time. The impact of that for our region was that 6 of our 7 counties had to lower their levy caps, and 1 member county was below the 3913 and declined to raise their levy at that year up to the cap. So that did create some hard feelings within the region. My board members met with that other member county. We had discussions, and this year everyone is levying at 3913. One of my concerns with levies and regions and funding is that discord that can be created between whether everyone's going to levy the same or we're going to not levy, we're going to be lower, we're going to be higher, can really create a lot of ill will within a region and can break regions up. And regions are a good thing. We are able to do things that we would never have been able to do as separate counties. But regions need to be stable, and we need to stay together and work out differences and not explode. And so that's one of the reasons when you see my suggestion for funding later on, one of the reasons I've looked at it that way. So, then also in fiscal year 18 is when we began our acting. I pulled out the expenditures for fiscal year 18 that we used on starting up our ACT team, which was around $541,089 that year. But what you'll notice on the region service and administrative expenditures line under column B is that our region service and administrative expenditures actually went down from fiscal year 17. And the reason for that is that we had people move from RCFs back into the community with our ACT team. And so, and that was a difference of, I believe, of something like $97,000, $96,653 reduction in services that we were paying for in an RCF, as opposed to, so there were kind of dollars that got transferred over to supporting our ACT team. I just wanted you to see that, that some of these services we're building actually for a region, as the services get up, we can divert some dollars from services we're not funding currently to those new services. Column C, fiscal year 19, which is our current fiscal year, like I said, all of our member counties are levying at the per capita, maximum per capita rate. And then expenditures, our expenditures increased in fiscal year 19. Some of that in our administrative and service line. some of that is we added some other services. We added iStart to our region to serve, to help our providers within the region. We increased our costs for telepsychiatry increased. We had more people utilizing that service through our emergency rooms, and also those rates just went up. Implementation of jail services this fiscal year. We've done C3 trainings for providers and community. We have also began our provider value-based incentive program for our providers, and we had significant increased costs for sheriff transportation with increasing sheriff's rates, and then also providing sheriffs with alternative transportation through Central Iowa Juvenile Detention. Our sheriff transportation costs went up by $66,000 this past fiscal year, so that was in fiscal year 18. So, and then with our telehealth psychiatry, we saw, last fiscal year, we saw an additional 216 individuals than we did from the year before. So that accounts for our rates going up with, for that year. And then we also have dollars in there. This year we will be spending $2,225,000 toward the Access Center. And in fiscal year 19, we will continue with about another $225,000 in support for the Access Center. Then if you look at fiscal year 20, there's a slight reduction in the predicted levy amounts due to a trend of decreasing population for rural areas, which creates another challenge to establishing a sustainable funding stream. When using population predictions to determine levy estimates, just so you understand the graphs below, there's a 3-year gap in fiscal years. For example, fiscal year 14 population estimates are used for fiscal year 17 levy calculations. And carrying that forward, fiscal year 17 population estimates will be used for fiscal year 20 levy calculations. The Census Bureau will conduct a new census in 2020, and then those results will be used to adjust levies. So for our region, using those population estimates from the Iowa Data Center, you will see each year a drop in estimated population for our region. So from 14 to 15, there was a drop of 112 individuals. From 15 to 16, a drop of 206. And the estimated drop in population from FY 16 to 17 is 358. So that impacts our levy, also the size of our levy, and sustaining our region as we go forward. And then on graph B is just the correlation of those population amounts into levy amounts. So from fiscal year 18 to fiscal year 19, it doesn't seem like a significant amount of money. It's $7,846. But but year after year, it just keeps ratcheting down what our levy capacity can be. So then, going on to page 5, in fiscal year 20, we will still have in our fund balance $1,600,000. And that will be used in the development of the intensive rehabilitation service homes. It will be used also for crisis stabilization and community-based services and getting that up and going that year. It will also be used to assist with supported employment, evidence-based practice, individual placements, and supports model. And that will bring our region to having completed all evidence-based practice in core and the new core and establishing it within our region. Those dollars, it would also be utilized to cover the expected shortfall experienced by the Access Center. First year of operation, the estimated shortfall is $85,000. I think it will be more than that, simply because that estimate is predicated on some assumptions that All accreditations, licensing, and contracts with MCOs will be in place by November 1st, 2019. And also, if that goal isn't attained, then the cost will be considerably greater to the region to keep it supported as as that becomes implemented. We are already in discussions with our neighboring regions about contracts for our access center and helping cover the uncovered costs as well, and those talks have been going very well. The regions that are interested are the CICS region, which is to our north. They feel the access center has potential to be very beneficial to Warren and Madison County. Then also the Southern Hills region, which is to our west. They are looking at perhaps contracting with us for access center services as well. And then also South Central Behavioral Region, especially access for Appanoose County in their region because of just distances. And also where people tend to travel, Appanoose County, individuals in Appanoose County tend to travel to our region for medical care and mental health care as well sometimes. So, so we're looking at trying to spread those unmet costs and with other regions, and right now we're talking about it based on utilization and stuff. So, so there is that collaboration being discussed and worked on. If the other cost that we're looking at is also if support of our ACT team rates, and if reimbursement rates are not increased to a sustainable level for our ACT team, then financial supports for those shortfalls in that program will also need to be continued by the region. Then in column E, fiscal year 21, at that point in time, all the services should have been created and all core are met. The fund balance has been spent down by the region, and but the region's costs continue to exceed levy revenues. And continued financial support for the access center is anticipated. The beginning fund balances continue to decrease as well, just meeting the 25% carryover to the next fiscal year. It is in this year, fiscal year 21, that the region anticipates if there's no change in funding that we will have to institute a waiting list for services for individuals. And then in column F, fiscal year 22, if measures are not taken to stabilize the financial status of the region, expenditures will continue to exceed revenues, resulting in the region having an inadequate remaining fund balance to carry over to the next fiscal year. The region will be unable to financially sustain the first quarter. And then in fiscal years 23 and 24, the region is running in a deficit with negative end-of-year fund balances, and CROSS will need additional funding or will need to institute fiscal measures to reduce those expenditures. So that's what it looks like, what the projections look like for our region if we do nothing. If the region takes no action and if there isn't some form of additional funding, that's what it will look like for our region. So then, going to page 6, well, I guess I'll stay on 5 for just a little bit. Then what CROSS region needs to maintain a workable fund balance and sustain services? We need adequate Medicaid rates for providers. Sustainability of services is a marriage. It's a marriage between region funding, it's a marriage between Medicaid funding, it's a marriage between providers being efficient with their services and trying to keep their rates within their costs within a reasonable amount. And so we need all partners to work together and to do their fair share. And so Medicaid rates are one of the issues that are very important for us. I also think, and this is a little bit off to the side, but you know, this is my opportunity, I guess. Insurance parity. we are creating a wonderful system for Medicaid clients, a great system, mental health system, I think, for clients who are Medicaid. But it's very difficult for families who are middle income, lower middle income, or upper middle income to access those services and to get them. A lot of insurance companies don't cover it. And so insurance parity is very important for the entire population. And so that's all I'll say on that, but I just wanted to get that in there. Transparency from MCOs on billing criteria. The devil's in the details, and the devil's in the details when it comes to billing and getting reimbursed through the MCOs. And so having it be very transparent what that criteria is, so providers can address their services and bill correctly, and then be reimbursed for the services they provided. There also needs to be a timely processing of eligibility for individuals applying for Medicaid services. A lot of what the region funds right now, or at least our region does, is that gap in time when someone is identified needing Medicaid and needing to get into Medicaid services, and the time it takes for them to actually be approved, and for individuals with mental health to get through the integrated health home system and get approved for habilitation services. That can take 3 to 6 months time for someone to go through that process. And so the region, we step up, we fund that individual for services during that period of time. But if that period of time could be reduced even just to a steady 3-month period of time, that would help regions because that would reduce our costs in that area and allow us to divert costs to some of these crisis services that will need our continued support going forward. Another thing that would be helpful for us is an adequate per capita levy rate. And so, and I'll talk about that a little bit later when I present you with my thoughts on how maybe regions could be funded. And then acquire additional funding streams through grants and community partners. Like I said, it's a marriage, it's a partnership. I know regions do work towards trying to find grants and things to help them create services, but grants are short-term funding and those services have to be sustained. So again, we go back to what can the Medicaid rates that perhaps those services begin with really help sustain them, and then also can the regions have enough funding that they can help sustain those services as well. And then a strong service management and case management team within regions to help people acquire the best service for their needs. Our focus in our region is that people are safe, and we try to meet those safety needs first. That requires, we have some wonderful coordinators in our region, as do other regions, and they work very, very hard to make sure that people are safe, they're getting what they need, and that we're getting them to the best services that they need in the future, and trying to navigate through that, the Medicaid, IHH, MCO world for them and get them to where they need to be. So those are very important things we feel in our region for sustainability. Then going to page 6, and kind of going back to Medicaid rates, ACT funding is at a sustainable rate is a critical area for regions establishing new teams, as we did. ACT teams are funded for 5 days a week, but the service is a 7-day-a-week, 365-day-a-year, 24-hour-a-day service. The current rate is $51.07 a day. Our team has done a cost report comparing the costs of urban teams and rural teams, because we have a rural team. The urban team unit rate came in at $64.90 a day at a 5-day-a-week reimbursement for those services. The rural team rate came in at $92.46 a day, 5 days a week. for the same 7-day a week, 365-day, 24-hour-a-day service. Rural teams travel much further distances. Our team travels 350 to 500 miles a week per staff member. We have 6 staff members. We have two offices in our region so that those teams can limit their travel time. So we have one in Marion County, and then we have one in Decatur County office, and teams in those areas. Rural team rates, with the increased travel time and the decreased client to provider ratio that rural teams see, their overhead costs and personnel costs are higher. Rural ACT staff and professionals, as I said, see fewer people a day because of those distances that they have to travel. The department has a work group evaluating the daily rate for ACT teams. The new rate needs to consider the complexity of the teams, the fidelity requirements of the teams, and the differences between rural and urban teams and their associated costs. For us, the second grant year for our ACT team ends February 2019. CROSS has agreed to provide weekend and holiday funding for the remainder of the fiscal year for the 40 ACT team clients in our region. Of those 40 clients, 4 of them are fully funded by the region as they are waiting to be approved through Medicaid funding. And so for the remainder of this fiscal year, we have committed $91,926 to sustaining the ACT team. If CROSS needs to continue to supplement funding in fiscal year 20, the annual cost will be $280,885. With adequate Medicaid funding, these dollars can be used for other services, especially towards our crisis services, because, and I'll talk a little bit about what we see as potential problems with funding with access centers and as we go forward. As an additional note, as I noted, CROSS has a poverty rate that exceeds the state poverty level. And in fact, CROSS has some of the, as I said, poorest counties in Iowa. This means providers in our area rely more heavily on Medicaid funding to sustain their businesses. Home and community-based services providers have a client population that is 80 to 90% Medicaid funded. So they really do rely on Medicaid rates because that's the population that we serve the most. And we don't have down in our area large organizations like United Way and some other community organizations like that that can help supplant sometimes some of the funding for those services. So Medicaid rates are very critical for us. Adequate Medicaid rates are, as I said, are just crucial for our services. The Access Center, the way our Access Center is put together, it's one provider under one roof. The services, one of the potential complications we see is that currently under Medicaid services under one provider and one roof create billing challenges. The current policy right now is that multiple services in one day by the same provider for the same individual will be what they call edited. And the outcome of that is that either only one of those multiple services will be reimbursed, or you're going to, those claims are going to be caught up for an extended period of time, and you may not receive any reimbursement. And the MCOs, in a recent meeting, the MCOs stated that they need a policy clarification from IME approving payment for multiple services on the same day for the same individual under an Access Center service array. So again, I just bring that forward as something to look at and watch as to what I think regions need and what providers need in order to make these services viable for the future. And then going to page 7, I put here a suggested funding option that I've been thinking about, and I just want to share it with you as you ponder over how to solve this problem that we have, the growing pains that regions are experiencing. And so what I'm putting forth is that the levies, to reduce all levies to the current lowest region per capita amount of $25.84. This will create a statewide uniformity in levy rate and end the levy roller coaster ride some regions experience. It'll reduce member county friction over levying and also giving regions more internal stability. We know what we can count on. Taxpayers will have some, feel that they will know what their tax rate's going to be, that it's 1 year it's not going to go down and next year it's going to go up a lot. Implement a protected sales tax, a 3/8 cent sales tax to be split between adult mental health, children's mental health, and substance use treatment. My understanding is that's approximately $180 million. The reason I suggest those 3 services is because we are all so interlinked. Children's mental health impacts adult mental health. Adult mental health impacts children's mental health, and substance use is threaded throughout it all. And we need more dollars for treatment. For substance use treatment, people shouldn't have to wait weeks to get into treatment when it's been identified this is the problem, and they're ready to do something to address it now, but 3 weeks from now, that may not be the case. Then the portion for adult mental health services will be used to backfill the base levy rate up to the current 47.28 cap as needed. As you'll see in what I have below for cross region, is that the chart illustrates how this would impact us. The cross can sustain a modest growth in services, maintain a fund balance sufficient to cover the first quarter of fiscal year 22 and subsequent fiscal years without initiating a waiting list. In fiscal year 21, as you can see, the per capita levy rate stays stable at $2,023,737.12. The sales tax then is proportioned to meet what the budgeted costs are for the region for that year. So our new per capita rate, fiscal year 21, would be $40.27, and in fiscal year 22, $45.50, fiscal year 23, $45.95, fiscal year 24, $46.69. And each of those years, as you see in the chart below, assuming that the 25% carryover is still in place, that we are carrying over only 25%. We aren't creating a large fund balance. We aren't sitting on a large fund balance. If there are services that need to be created, we can put that into the budget, which is submitted to the Department of Human Services for approval, and ask for the backfill to be adjusted proportionately to those new services that need to be put in place. So that is something I would like you to consider. And then going on to page 8. So if nothing changes and we're where we're at, then as I said before, across the region will have to implement a waiting list, most likely in fiscal year 21. This is not a preferable solution. It means that people lose services that support and supplement core services, adding to the value of core services and their effectiveness. Expenditures capped at a level to allow 25% carryover. Expenditures will be capped at a level to allow for 25% carryover to the next fiscal year. And so, so all services will have to, that the region's funding will have to live within our cap. And so on page 9, I have a graph showing the leveling of expenditures and revenues, just to give a sort of a picture of what it looks like as we, as our expenditures go up to create new services, and then as they level down, and then things will just stay static, and the dollars will have to be managed in that way. So to help illustrate what a waiting list might look like, and what are those services that regions cover that aren't core, that help really support core services and make them more effective. Well, some of the, what I call essential non-core services that we fund, and there are others, but I just pulled out probably the top tier that we seem to fund a lot: transportation, rent payments, representative payees, guardianships, conservators, basic needs, which that means if someone needs food, if they need food, cleaning materials so they don't get evicted, so you can get their apartment cleaned up for them, those types of things. Prescription medications, transitional living, and residential care facilities. And residential care facilities receive, for our region, is the top user of our resources. It's our #1 expenditure in our region, our residential care facilities. So to make it more human for you, we have, I'll give you 3 scenarios of 3 individuals we currently serve who receive these services and would potentially not receive them or have a drastic reduction. My first example is an 81-year-old veteran who does not qualify for VA funding. This individual has been living in an RCF facility, well, several different facilities for more than 30 years. He's very institutionalized. This person's pension does not cover the cost of care. The region is contributing $1,860 a month, or $22,320 a year to his care. That funding would end. And individuals, and so if that funding ends for this individual, it would mean trying to get the individual into either a 24-hour rehabilitation home, and because at this point the individual would not qualify for a nursing home. But individuals who have been institutionalized for that long of a period, and especially for our elderly folks, have a very poor success rate transitioning to the community. So more likely, this would have a very negative outcome for this individual. The second person is a 40-year-old residing in an SCL residential care facility who receives pre-voc services with the nearest provider, who is 30 miles away. Habilitation services do not cover transportation, so the region is paying for transportation to these employment services. These employment services are very important for this individual's mental health, and this individual does much better when engaged in those services. This individual is also unable to obtain a driver's license due to health problems. Those transportation costs for the region to cover are $1,191 a month, or $14,292 a year. The region would suspend funding transportation, and this individual would lose that employment service. The third example is a 50-year-old with mental illness whose apartment's house caught on fire and lost all belongings and the apartment, because it was the entire building burnt down. The region provided crisis coordination, paid for a motel and food after Red Cross funding ran out, found placement in an RCF, and paid for services for 2 months, completed paperwork to get the individual on Medicaid, housing subsidies, and found the individual an apartment, and this person will be moving into that apartment today. The region will fund hourly services and is establishing these services for the individual. And without these essential services, the woman would be homeless or in jail today. So those are the types of services we will not fund if we have a waiting list. And those are the types of outcomes that will happen for people if we aren't able to help them. Now, that concludes my presentation. Thank you for stumbling through it with me. It's been very nerve-wracking, but thanks. And I'll open it up for questions.
Thank you, Kathy. I appreciate the presentation. Do you have any questions?
Thank you, Kathy, for joining us today. I'll keep it very short. I just want to say thank you for all your years of dedication and work. Those of you in the room that might not know this, Kathy is retiring in just a few short days. So we're going to lose a lot of institutional knowledge in our region. But we wish you well, and thank you for all your years of what you have done in the mental health area in our communities.
Thank you very much.
Yeah, terrific presentation, Kathy. Thanks so much. We've heard from 2 regions today. I know that I don't think the chair's invited a regional perspective in particular, but it's great to hear from 2 regions. But the presentation kind of alarmed me about kind of the financial position of these 2 regions. And I know Mr. Schultz presented to us about how great things were going. But it would be good to get a fuller picture of the financial position of the other 12 regions. I'm not sure exactly how to do that in the context of this being difficult to do. We didn't get a regional perspective. We got 2 region perspectives, which is great. But I'm wary about where we are financially, especially as, again, thinking about this requirement to spend down this fund balance. Thank you, Mr. Chair.
Thank you, Senator Goldman. Are there any, Senator Siegel?
This is a question for Kathy.
Sure.
Thank you for being here. Really enjoy retirement.
I plan to.
It has to do with page 7.
Uh-huh.
First question under the funding option for consideration. The first one says reduce all levies to the current lowest region per capita amount of $25.84. Does that mean reducing it the $47.28 down to $25?
No.
What does that mean?
That means right now each region has a per capita maximum rate that was with Senate 504. They averaged out the per capita rates for each region, and so throughout the state, the region with the lowest per capita rate, that rate is $25.84, and so. I don't mean lower the $47.28. What I meant by that is that each region's levy per capita rate would be $25.84, and then backfill with sales tax up to the $47.28 if it's needed. What I forgot to mention was that I also recommend that the $47.28 cap actually be looked at to have a study done and really look to see is that really the rate that should be that it should be. I think there's some discussion about whether or not that $47.28 cap is really relevant in today's world as to when it was evaluated. So that would be another recommendation I would make, is that you have your great financial minds work on that and see if that really is the cap level it needs to be throughout the state.
Thank you, Kathy. Thank you, Chair.
Thank you. Anyone else? Well, thank you again, Kathy.
Yeah.
And congratulations on your upcoming retirement.
Thank you very much. I'm going to be a goat farmer.
Next up, we have a county supervisor perspective, and one of the supervisors was unable to attend due to ailment overnight. So up next, we have Dave Thompson from Marshall County. Thank you for coming out today, Dave.
Good morning, you're welcome. It's a pleasure to be here. You guys have listened to a tremendous amount this morning, so I'm going to give you a break. No graphs, no charts, just comments from somebody that walks the walk, sits in the seat, and has to answer all the questions to the constituents at home. I've been in Marshall County starting my third term as supervisor. When we began, we were in debt. Today we are one of a handful of counties that are debt-free. Over a 10-year period of time, we have reduced our levy 9 of the 10 years and left it the same 1 of those 10 years. So it is possible to reduce your debt, take care of the needs of the county, and become fiscally prudent all at the same time. It is a juggling act. We've done so, and we've strived to keep our levy relatively the same because the taxpayer does not like that whipsaw. As a former county supervisor, you can appreciate the exact comments that I'm making. When I first took office, we were levying $54.78. Today, our region levies $23.02. Balances are extremely important. Our balances at the county are important. Our balances in our region are important. Marshall County, as you all know, we just sustained a terrible tornado. It did approximately $31 million in damage to our courthouse. It also took my business. We're both rebuilding. We will come back stronger and better. Neither one of those would have been possible today without the balances that we had, both at the county and my personal business. I would ask, because all of these balances that I'm speaking of today were paid for with property taxes. Be prudent with these figures. Don't make the individual counties or the regions spend them down in a rapid fashion. Allow us to spend them down in a timely fashion so that we can continue to keep a moderate line on that property tax revenue to the taxpayer. It's especially important in my county right now. We will be looking at dire problems with the destruction of the tornado, not only from the city's budget, the school system's budget, and the county's budget. Hopefully we can sustain that. I understand the problems that you have, and not all regions are the same. That's something that I'm afraid you have to deal with, not on our level at the county, but I applaud you for dealing with this on your level. One of the things as county supervisors that we're always very afraid of is unfunded mandates. We're very proud of the services that we provide for mental health services through Marshall County. Not only that, I also sit on as the chairman of Central Iowa Juvenile Detention in Eldora. We serve approximately 2/3 of the state for their detention for juveniles. We provide very good mental services there also. We have a psychologist on staff. We do evaluations for individual counties. We do transportations for mental health. All of these things that work together have left us the ability to provide the services that we do at a reasonable cost to the taxpayer. They are good services, and once again, we're very proud of it. Help us keep that. We want to stay consistent in our levy. Something that, for those of you that have been to county supervisors, that's very important to us. It's home rule. I have to see all these folks when I attend church, when I'm standing in line at Fairway getting meat to come home and have for dinner, or whether I'm just at a county supervisors meeting around. We are where the rubber hits the road. And believe me, if we have these vast swings in our levy rate, our per capita, we're going to hear about it. As Senator Edler full knows, when I hear about it, he generally hears about it from me also. So it does flow uphill. I don't want to take too much more of your time today. I would ask that you extend the ability for us to spend these balances down. Enjoyed Senator Bolcom's comments. I feel the same. It does not make sense for us to spend them down and then to turn around in a few short years and re-levy them. The taxpayers will revolt. Please save me those headaches of those phone calls. And of course, my phone calls that will then come down to this body after that. We have done, and I've listened to a lot here this morning, one of the things that really struck me is working with our jails and the services provided on the jail diversion program. Sheriff Hoffman in Marshall County is working very strongly with our local providers. It is working. This is something that needs to continue. Jail diversion is very appropriate. If we can stop this reoccurring cycle, not only through our jail diversion, but working with our younger individuals that are in juvenile detention, it's much easier to prevent than to provide later. And it's also much more cost effective. The subacute and the crisis care are similar to politics. It's all local. The closer we can keep this care to the individuals that we provide that care to where they're at, the better it will be. We're working on that in Marshall County and going to continue to work on it through the region. I also was one that was not a fan of the regions when we first put them together. Today, after watching it work in our particular region, I have changed my mind and I will be a proponent of them. My mind is not generally changed easily, but when it works, it just plain works. In conclusion, I'll be happy to answer any questions from a county supervisor perspective, but I would like to leave you with, please extend the ability for us to spend these funds down, which will then allow us to have not real wide swings in the levy amount and the per capita spending, and also look very strongly in understanding that all regions are not the same, and you're going to probably have to make some adjustments on the cap. With that, I thank you for your time. I wish you all a very Merry Christmas and enjoy it with your family and friends. I'll be happy to answer any questions you have.
Thank you, Supervisor Thompson. Representative Fry.
Thank you, sir, for joining us today. Would you react for us to one of the suggestions we heard earlier, which was that statewide levy being set across the state for everybody, essentially taking that away from county supervisors' purview, your notion on home rule? Could you talk to us about your perspective on a solution like that?
It's going to be extremely difficult for you to do that because, as I stated earlier, not all regions are the same. You're going to have a drastic difference in the population that each region may serve, the distance from that service being provided from those individual regions, and if everybody is handcuffed with the same exact amount that they may levy, that's going to make it difficult on the individual county's perspective. Set the cap high enough so that the counties can make it a prudent decision to spend down the allocated funds that we have, because nobody really likes government to have a whole bunch of balances. It is necessary. In our county balances on any individual fund, we shoot for a minimum of 25%. It is necessary. The largest proponent over the years of individuals not having balances in government has been Farm Bureau. We've addressed that the simple way. On an annual basis, we go give our budget presentation to the local Farm Bureau. We sit down and we explain why we have the balances, where they're at, what balances are restricted spending, unrestricted spending, and why, when we have larger balances, and actually we even have a capital savings account, it eliminates us from having to go borrow. We eliminate the spending of the borrowing and the costs that are associated with it, and we're able to keep that levy down. Back to the answer of your question, it's going to be extremely difficult to set an exact levy per capita across the state because of the differences within the regions.
Thank you. Yeah, thank you, Mr. Chair. Thank you for your presentation. When I was on the county board in the early 90s, mid-90s, when we had an ending balance to deal with, like the Farm Bureau, we would pass a resolution to say this money that's in our ending balance, maybe it was being saved for a capital project, as you know, but the board would actually pass resolutions to earmark the $500,000 or whatever the number was, that said this money is going to be, we've earmarked this for this purpose. How do you think it would work to have in your, for example, your region, if you were required to say, your region has this excess amount of money, how hard would it be to pass a resolution among the governing board? Would that be something that would designate where that ending balance was going to be spent, say in a 5-year period or 3 years, some window? How difficult would that be for the governing board? And would that be something that would go maybe back to each individual board, or or is that something that would maybe stay at the region working with your CEO?
With our individual region, I don't see that being a problem. As a matter of fact, I think they would welcome it as long as everybody could agree on it. We've got a good region. It started out, it had to be continuous counties, and it's changed since then. As far as your other ending fund balances within county government, some of them you can't earmark. When we get done at general basic, we can take those items and we can slide those over into a capital fund and earmark that they must be spent on capital. The rest just goes into our ending fund balances, whether it be general supplemental or the other areas within our balance, in our budgets. But I would see within our particular region, I don't think that would be a problem. I certainly can't speak for other regions.
Thank you. Thank you, Mr.
You bet.
Thank you, Mr. Chair. And I'm not sure if this is really a question for you, but I'm kind of curious, how long have we had so far when did you know you had to spend down your fund balance? How many years have you had to do that, and when did you start trying to figure out how to do it?
It's basically been 2 years now that we've been working at it, and of course there is a timeline and we have to get it down in there. I know Senator Edler proposed legislation last year that the ending fund balances go to 30% from the current, I believe, 20. I would highly recommend a minimum of the 30% ending fund balances.
Okay, thank you. Thank you, Mr. Chair.
Anyone else? No? Well, I want to thank you, Supervisor Thompson, for coming in and sharing from the county perspective. I'm sorry that Mr. Pat couldn't make it in today because he also was depth of knowledge on the true mental health side of the county. But we do appreciate the recommendation, and thank you for your time.
Anytime. Appreciate it. It'll be a quiet ride home without Bill.
So we have come to that time of the day for the public comments. I believe we have a list. All right, first up we have Jamie Cashman with Iowa State Association of Counties. And we have 3 minutes, please.
All right. Well, I'll try to keep it brief. I'm Jamie Cashman with the Iowa State Association of Counties. I kind of feel like I'm in a weird position because we've already had great speakers from the counties already. But there's a few things I want to touch on, kind of following up on what we've heard before. Finding a long-term funding solution to provide mental health funding for the counties and the regions has certainly been a long-time priority for ISAC and our members ever since we went to regionalization and even before that. But this is something I know Senator Segebart talked about. There were some angst initially with regionalization, but we found by the number of new programs that are out there, the innovations that they're making, the counties have truly embraced this and the regions have embraced this, and we're extremely proud of the programs we're putting out there, especially, and you heard about jail diversion. And Senator Boatcomb, you mentioned about tracking. There's a justice involved system that we're doing with the Community Services Association that will be tracking all of that. And so that's a new innovation. So we'll be able to track when they're coming in and out of the system. So I think that's a great thing. We'll talk about the solutions that we have. This is the final piece, we believe, in answering our mental health needs and providing those services, and it's on funding. And so we're asking to get rid of the mental health levy cap. We've made some adjustments to it over the years with Senate File 504. It went to a regional cap system, and it did provide levy equity for some counties within the regions. But however, there's some, as you've heard from some with Scott, the issues that they're having, the potential issues that Kathy's having. Scott's already, Polk's already underwater. We can provide you spreadsheets over the next 3 to 5 years. There'll be more and more regions that will be in that same predicament. So give us the tools, get rid of those caps, but still hold us accountable. We're accountable in multiple different ways. One, the service and budgets are approved by the Department of Human Services, so if there's something that they don't like with it, they don't have to approve it. But most importantly, there's this fallacy that all of a sudden if you get rid of that cap, all of a sudden county supervisors are going to go wild in terms of raising property taxes. Well, if I take a short survey of our members here, they don't want to raise property taxes because they're accountable in the most ultimate way, and that's to the voters back in their districts. And so, and also too, we've ran the numbers. As we've seen getting rid of that cap, we'll see a majority of the counties actually lower their levies as a result and allow those more populous counties to raise their levy and have some of the rural counties actually lower that as a result. So guess what? You'd actually provide property tax relief if you would do that. Second, we're asking to get rid of the 20 and 25% carry forward balance and allow the counties and the regions to be able to spend down at a much judicious level. But first and foremost, the 20 and 25% carry forward balance is just on basic cash flow purposes, let alone to provide the new services on complex mental needs. So thank you very much.
Thank you, Jamie. Next up, we have Russell Wood with Iowa Community Services Association. Thank you for coming, Russell.
Thank you. I want to, before I get going, I also work for Central Iowa Community Services. I'm the planning officer there, and I just want to thank, I've got a lot of my representatives and senators that actually are in this group, and I wanted to address real quick one of the questions that you asked Representative Fry earlier. You had said something about how did we get on different fund balances, and there's a saying about when you go to breakfast, the chicken contributed, but the pig committed. And our region's a little different than other regions, that when we came together, our 28E said, everybody's going to pool your fund balance right now. And everybody's going to levy the maximum unless the governing board tells you otherwise. So we're not like some of the other regions that some of the counties, they have, I'm going to levy this much or I'm going to levy that much. And so what that did is that ended up with us having a very large fund balance to begin with. The first year, because we didn't know where we were, we did levy the max. The second year, we went down to the lowest allowable levy in the region, and we continued to do that until the fourth year when we went way down, and we are way down. And so if you look at where our region is, we are levying below what we're spending, and we are continuing to reduce those fund balances. But our fund balance situation where we are started when we became a region, because we weren't exactly sure where we were going, but we knew what we wanted to be, and that was if we're going to be a region, we want to be a region. We want to commit. We don't want to just contribute. So that's kind of where we are. But from the Community Services Association, I want to just hit three things for you if I could. First off, to answer a question that Senator Bolcom had. When this legislation was originally written, I remember having conversations with Representative Heaton and Representative Miller about fund balance issues, and one of the things that Representative Heaton had said is that we want to put 25% in there, at least because we want people to know that it's okay to have fund balance, because you need that fund balance. The legislation as originally written said that it would be 20 or 25% of your projected expenditures, of your budget. The projected expenditures or budget was changed to actual expenditures, but the 20 to 25% was not. So what that does is that puts me as a region, or our region, every region in the state, in the position, if we're at that 20%, then we don't have enough money to pay that first quarter. So we're going to have to hold bills until we get money in September for our property taxes, because you're only letting us hold 20%. 3 months is 25%. But it isn't just once a year. It's twice a year that this happens. When we get down to 20%, twice a year, we're going to be broke. Twice a year, forever and ever and ever. And not only that, we have no money to develop ongoing services. The 25% was supposed to be cash flow. All right? So that's just something. I also wanted to point out, I know that there are counties that are reducing levies. I know that was asked. Senator Bolcom and other people do see that we are reducing levies. And I have heard from some legislators outside of this group that they think it's a game that counties or regions are playing, but it really is not. What we're looking at is trying to reduce the amount of money that we have in our fund balances, because that's what you had asked us to do. So thank you very much for your time.
Thank you, Russell. Dawn, I can't read the last name. Smith, sorry.
No problem. I do that old-fashioned thing called cursive, and sometimes that doesn't work out so well. Good morning. As I said, I am Dawn Smith, and I am chair of the Cedar County Board of Supervisors over in Eastern Iowa. I am past chair of the Eastern Iowa Mental Health Region, and I'm currently president of the Iowa State Supervisors Association. And all of that has been in 4 years. So when I started on with the Board of Supervisors 4 years ago, this was a whole new ball game. I didn't know any different. So I came into it with the way it is right now. I dealt with a lot of supervisors who hadn't had that previous experience. And there was a lot of hostilities. I am not going to say that there wasn't. We had a major levy inequity within our region. We had one that was in the $17 range, and then my county was at the max of $47.28. And if you think that I thought that that was fair in any way, shape, or form, it was not. We got together as a region. I have been friends with some of the people on our region, and I've had agreements to disagree on different issues within our region. My job was to hold our region together, and I came and testified before a Senate committee a year ago and the year before that, and said that our key drive was to hold our regions together. We have done that. We have done everything you've asked us to do. We have done core services, core plus services that are now core services. Now we are understanding that children might be coming our direction because we've done all of those things. We're not opposed to that. We just want you to take your time in implementing that so that we can adjust accordingly. If we need to adjust administration and those kind of things within our regions to handle that, we ask that you do that in a slower, responsible manner. As far as the levies, I've heard multiple different suggestions on what to do with that today. It is our opinion from the State Supervisors Association that you remove those levy caps. We are in charge of our levies. We try to do what's responsible. We don't want to raise them if we don't have to. I understand that that is a big request on our part, but if you're asking us to implement these services and to make those right choices, we ask that you give us the capability to do that. The other thing that we look at is the levy balances. I understand that you had some concerns about our large levy balances that we had. Due to Senate File 504, we felt that we had to get that spent down within a certain amount of time. I'm from a very small county. We took it down to 37.28, I think, 2 years ago, to see where that took us. That did not take us down far enough, so we went down to 0. We did have one county initially 2 years ago, which was Scott County. After this body had made their decision to late in the game, after everybody had certified their budgets, they wanted us to bring those levies down. We can't react after the fact. We need these decisions made early on, which is why I applaud this committee and for what you're trying to do. If these decisions can be made early on in session, that is very helpful to the counties when we're trying to do our budgets in a timely manner. And I know I've only got 3 minutes, but I also wanted to say I did take a little bit of an objection to the fact that I got the impression you thought we were irresponsible by zeroing out our budgets. Some of us had to do that in order to get it down where it needed to be. There were 2 larger counties that I felt maybe did it in a little bit of retaliation to the largest county. But in all fairness, that's water under the bridge. We've moved forward. Everybody is evening out their playing field. And I just ask that you consider these things that I've mentioned when you make your decisions. Thank you.
I would say at the end, I may be able to bring someone back if they still have more to go beyond the bridge, so.
Okay, that's fine. Thank you.
Next up, we have Amy Campbell from Polk County, representing Polk County.
I know you've all heard from me before, but wouldn't want you to miss out on Polk County's situation. But thank you. I'm Amy Campbell. I'm the lobbyist for Polk County. Our regional administrator couldn't be here today, so I apologize for having me instead. So if you have any questions, I'm happy to bring her, get you the information from her. Just a reminder, Polk County was frozen in 1996 at $14.4 million in their budget. Nearly over 2 decades later, we still have $14.4 million to spend, despite a 40% growth in our population. That's 150,000 more people to serve. In addition, our services have evolved over that time as well, and then in addition, the complex needs services that were added in last year's legislation. So every year we have about a $6 million funding gap, and that's been pretty consistent. We're looking at this year ending our fund balance with 3%. So we have spent that down and are projecting in fiscal year 21 a serious deficit of $13.3 million. And that comes about because at the end of this year we'll have in fiscal year 20, we're projecting about $5.3 million gap. That's because we have $14.4 million in property taxes, and we have a combination of funding from Broadlawns, in-kind services, and cash that you all were able to provide us as a temporary fix until we could find a permanent solution to funding regional services. Those dollars go away in 2021, and that's why you see our gap going from $5.3 million to $13.3 million. So I would reiterate what you've already heard. We would ask the legislature to consider a permanent, sustainable funding fix that would allow the regionals, governing boards, and the county boards of supervisors to raise the levy rates to what they need to be to provide the services. All but $120,000 of our services are required. That $120,000 is for kids services that we provide that help them stay in their own homes. And if we were not able to provide those services, those kids would be at imminent out-of-home placement. And that's why we continue to provide those services. But it's only $120,000. If we could find another source for those, we would, but that certainly doesn't even touch the $5.3 million that we have in, that we're short every year. So we would ask that you find a permanent solution for Polk County, a $100,000 home. That would be $17 a year more in taxes that would be paid. So it's something our board is ready to do and feels that they've heard from their people that mental health is an important service. Thank you.
Thank you, Amy. Next up, we have Kim Murphy with the Iowa Hospital Association.
Good morning, or maybe it's afternoon now. Thank you for making time for a public comment today. I'm Kim Murphy with the Iowa Hospital Association, and the association represents 118 community hospitals across the state of Iowa. I'm also going to speak today to a coalition that the Iowa Hospital Association is a part of, but before I do, I just want to emphasize the importance of this topic to Iowa's hospitals. We have been advocating for changes in the mental health system and access to a continuum of care for many, many years. And that's based on something that you're probably well aware of in your communities and that you hear about often. And that's patients that receive emergency room care or inpatient psychiatric treatment and do not have resources to transition to. It's
It's a desperate situation and we need resources to address this, and that's where House File 2456 comes in. But this need, as I mentioned, is recognized by more than just hospitals, and that's why I want to speak to a coalition. We've been part of a statewide coalition titled the Coalition to Advance Mental Health in Iowa, or CAMI. The coalition is comprised of representatives from numerous organizations, and that includes hospitals, NAMI, sheriffs and deputies, advocates, parents, and a host of providers that include social workers, nurse practitioners, and behavioral health providers. And a lot of those organizations are represented here in the room today. Recently, CAMI met to determine priorities for the upcoming year, and a top priority that was identified is to ensure appropriate and adequate funding for the services created by House File 2456. The work that you are doing to identify funding is incredibly important to so many, including those on the coalition. Last session, you passed a bipartisan piece of legislation that will create landmark change in this state for those suffering with mental illness. It will create services and supports at multiple and vital care levels. It will free up inpatient beds for those who need inpatient care and ensure a least restrictive environment for those who no longer need hospital inpatient care. But these services and supports won't advance and they won't be developed unless there's adequate funding. So we ask that you come together again like you did last year and find a way to make sure these services and supports are funded. Thank you for all that you do, and please know that you have the support of many organizations, including those on the coalition, providers, parents, and patients, as you move forward in identifying funding. Thank you.
Thank you, Kim. Appreciate your input. Rick Sanders with ISAC Supervisors.
Hi, good afternoon. I'm Rick Sanders. I'm chair of the Story County Board of Supervisors. I'm starting my third term. I've been chair for each of the last 4 years and 5 of the last 6. I'm also a vice president for the statewide supervisor board, and I serve on the MHDS commission for the state. Story County's our favorite daughter, Lisa Heddens, and I have talked a lot about mental health services and what we need to do a great job providing them. I need to start with this for you guys. I am an absolute staunch fiscal conservative. I believe that government needs to be restrained wherever we can restrain them. And in fact have done that in Story County. In the 3 years before I took office, Story County actually spent $121 million. That would be 2008, 9, and 10. In the last 3 years, 16, 17, and 18, we spent $115 million, even over that amount of time. I say that to you today because I want to underscore how important I see this issue. We are rapidly approaching an absolute funding crisis in our mental health system. So I'm one of those supervisors that was not a fan of moving to regionalization. I felt very strongly that Story County knew what was best for Story County residents, and we were doing a good job providing those services in Story County. That was my concern. I will tell you, as I look back on it, regionalization was exactly the right way for us to go. Instead of my fears of us watering down the system and legislating to the lowest common denominator and the minimum required services, in fact, the opposite has happened in many of our regions, and it's become this incubator to try new ideas and really try to identify the best and most efficient ways to provide these vital services to our residents, because this, as we all know, is a crisis that is growing in scope, and we have to be able to deal with it. So I sit here before you today to encourage you to get rid of these artificial caps that you have on us, and hey, demand that we explain at the regional level and at the county level what we're spending the money on and why it's being spent, but then trust us as elected officials like you to serve our constituents in the best way possible. Second thing I'll say, and I'm really encouraged by some of the conversation that's going on, particularly Senator Bolton talking about earmarks, which we call assigning funds or reserving funds. You need to look at those ending fund balances in 2 different ways. And if you're looking at it simply as the cash flow carry forward that you need for your operations, then putting a percentage on it makes some sense. I mean, I can see where you would want to do that. Please be as flexible as possible. But if you're looking at it in terms of development of services, a cap is not appropriate. I'll give you a quick example in Story County. We just 2 months ago, we opened a crisis stabilization transitional living unit. It was a great partnership between the county, Mary Greeley Medical Center, and our region. The services are all going to be paid for, but it cost us $500,000 to get the facility ready to be able to provide the services. If we didn't have access to those kind of dollars in our ending fund balance, we could not have provided those services. Thank you so much for your work, and please help us serve our residents. Thank you.
Thank you, Rick. Next up, we have Susan Cameron Damon from Iowa State Sheriff's and Deputies Association.
Good morning or afternoon. Thank you for the opportunity to be here. I'm not going to say much because you've heard it all today, but what I want to do is thank you for the work that you've done over the last couple of years to start moving this ball down the field. There's been great progress made. As you've heard, the Sheriff's and Deputies Association supported the legislation earlier this year, is very proud of the work that's being done in jail diversion. And we just want you to know that we believe, the people around the room today, that if these mental health services are not adequately funded, cost of property taxpayers will continue to be shifted, resulting in rising jail medical costs and deputy overtime transporting individuals who are being involuntarily committed across Iowa. Therefore, the Iowa State Sheriff's and Deputies Association supports what you've heard today to remove the carry forward balance restrictions, to consider eliminating the levy caps, and to ensure that those who are Medicaid eligible, those services are paid adequately and in a timely manner. As I mentioned the jail medical costs, I hope that I can come to you in a couple years and tell you that this has gone down, but we have just been surveying the county sheriff's offices to find out what they actually spend in mental health costs, or not just mental health costs, but medical costs in the jails. Polk County is just under $5 million. Black Hawk County is $1.28 million a year. Woodbury County is just under $1 million a year. We're spending a lot of money that isn't even built into some of these programs. Transport costs are a supplemental service. They're not a core service. So those costs also are not built into to this mental health program. So one way or the other, we're going to have costs, and we believe it's best for the patients and the Iowans to get them the services they need through the legislation that you've passed so far. So we appreciate you looking at the ways that have been recommended today to give the regions the flexibility they need to fund those services. So hopefully we can come back in a few years and our jail medical costs have been reduced. Thank you.
Thank you, Susan. And that is the last representative I have on the list for public comment. So at this point, I will go on for the committee discussion. Once again, I want to thank everyone for coming in today and the input you provided as a valuable resource for the legislators as we move forward and continue to make steps on improving our mental health treatment facilities. At this point, I'll just go around one at a time and ask for any additional comments. And we'll start with Representative Bennett.
Thank you, Mr. Chair. Well, I guess I was just reviewing the charge for this particular committee, and I know we're supposed to submit some recommendations. So I certainly want to have the discussion on the committee's thought of getting rid of the mental health levy cap. I mean, I've worked on legislation for that for my past, I don't know, 15 years on that particular issue, and I know it has not gone anywhere, but I think it's time that we start talking about that. And then also addressing that 20 or 25% funding balance, because listening to the folks that were on the agenda and from public comment, that certainly seems to impede them in developing of services and looking for sustainability. So those are my initial thoughts that I hope we can have some discussion on before we adjourn today.
Thank you, Representative. Senator Bolton.
Well, thank you, Mr. Chair. I too thank the supervisors and the people from our regional mental health system, the representatives from the specific counties as well as the more regional perspectives. I appreciate the speed testimony that was given in the public comment period. It was quite helpful. It seems like we really can't wait until December 2019 to make some progress in improving what is currently on the books in the state. I know we've got a charge to make recommendations in December 2019, but from what we've heard today, it's pretty clear that the current state policy is destabilizing the adult mental health system in Iowa. I suspect if there were more regional CEOs here today, we would have heard more stories of concern about their short-term financial pictures they try and address. Our desire to have them spend down their ending balances. It's not really even clear to me what the purpose of the policy is, other than we don't like that people have money in their ending balances. We weren't very directive in terms of what goals we wanted to be accomplished with that money. And so it seems really kind of counterproductive to where we are. It's pretty clear that we need 25% ending balance simply to cash flow the services that we expect people to provide without people pulling their hair out and worrying that both providers and administrators of these programs. And then it seems to me the money beyond the 25% reserve, we ought to have a process to designate how that money is going to be spent in a particular period of time, whether it's 2 years, 3 years, 5 years, to put forward these new services. I mean, at a time when we've asked them to do more, we've destabilized their financial picture. So I hope we can in 2019, this legislative session, continue to visit with these folks and come up with some policy adjustments to our current law. And I guess I'd also throw in, this comes at a time when there's another group of people, some of them are in this room, that are working to try and develop a children's mental health system. And one of the places I think people are looking, which I'm supportive of, is to try and utilize the existing infrastructure of the adult system. And if we destabilize the adult system, it just doesn't seem like the time where it's going to make much sense to try and bring children's services through a regional model. So I think we can work together on this. We make adjustments all the time in what we do, and I look forward to doing so. Thank you, Mr. Chairman.
Thank you, Senator. Representative Gunnar.
Thank you. And thank everybody who came today and presented today. This is a good group. I think that we've all kind of met with our county supervisors. We've gotten their input. I met with ours on Tuesday. They echo what the county supervisors shared with us today in person. I think that we are all here for good reasons, but there are unintended consequences of what we sometimes do, and I think that we're hearing that pretty loud and clear today. I think that we have had legislation in the past that we thought at the time was good. Even recently, we've done legislation where we thought we at least took some positive steps forward. I think that, or at least I hope that in 2019 we can go back and really look at that funding balance and the levy. I really hope that we don't wait till 2019. I tell everybody at home, when we say we have an interim committee meeting on that, that means we're kicking it down the road and we're not going to do anything. So I really hope that we actually can do something with this. And it really sounds like from all the county supervisors in all the regions that maybe waiting until 2019 is not a good idea. Maybe kicking this can down the road isn't maybe a positive thing to do. We know we still have problems. I work in healthcare field at home, and I can go through, story after story of what we made some good steps, but we still have problems. So I hope that this is a great committee of folks. I hope that this committee can take back and make legislative changes in 2018. Thank you.
Thank you, Representative Carlson.
Thank you, Mr. Chair. Yeah, I appreciate everybody's testimony and the information. Every time we get more information, it always begs the question, what other additional information would we like to see? And we have fiscal year 2018 ending fund balances, but it would be nice to understand what the projected fiscal year 2019 ending balances are and how that balances against what still needs to be implemented, or perhaps a better update on what their implementation costs are to allow them to comply with the legislation that we have. what's encouraging, we didn't hear any testimony that what we have passed in legislation is negative about what we need to do to deal with mental health. There may be some additional expansive things that we have to look at, but they're not negative things. And I'm not so sure I was hot about the idea of regionalization either when it first came out, but when I talked to Lori and when I talked to our county supervisor, I think there clearly are services that are being offered today that would never have been able to be offered if we hadn't had so much regionalization. I think that's the opinion we heard today through testimony. So we were on the right path, but there's still some questions that we need to ask ourselves to make sure that we effectively get in place the services we've legislated to have.
Thank you, Mr. Chair. Again, echoing the thanks to all of you who have joined us, both of this meeting and the last meeting. We had some great dialogue today. I think I am of the opinion, as many of you are at this point, that we had some great dialogue. We have many more questions to be asked as we move into this next legislative session. And so I will be recommending that we ask LSA to draft a report that reflects all of the different ideas, thoughts that have been presented, and that we would then in this next legislative year begin to move forward and consider these ideas plus others that I think may be out there that we haven't had at the table yet, and that we would look in this new year at how we might be able to continue to sustain and create a mental health system in the state of Iowa that is of quality as it is today and for the future. Thank you, Mr. Chair.
Thank you, Representative Wright. Senator Costello, start.
Okay, thank you, Mr. Chair. I guess I come away with a pretty positive feeling about a lot of what we're doing. And I'm encouraged with a lot of things that Rick shared, that the regions are doing what we've asked them to do, that they're stepping up, they're trying to work through these issues. I guess it's probably a good thing that we're trying to get these things ramped up now when we have some ending balances, and maybe that's a good idea. That's what we can use it for. I hope regions are doing that. I suspect maybe we've heard from some of the regions that have struggled a little bit more in more than one way, and some of the regions are doing okay. Now that said, I totally get the problem with pushing the levy way down and then back up and all that. Nobody likes uncertainty, and so I think that's something we could look at, trying to figure out how to smooth that ride out a little bit, and maybe figure out what the reasonable ending balance might be. I see a problem with Polk County. I'm not sure what to do with that, but we need to keep working on it. I do appreciate the effort that goes into everybody that presents. It's always stressful to try and get something together and go ahead and do it, so I do appreciate that. Thank you.
Thank you, Mr. Chair. I want to start out with a question for Russell. In about the last 25 seconds of your 3 minutes, you spit out very quickly when the law changed, it went from presumed expenditures to actual expenditures. Yes. Can you, I don't know if that's, I'm not a forward here probably. At any rate, I'd like to hear a little bit more about that, because that seems, when I became a supervisor in 1997, the big hubbub was about capping rates, and in 97, it was actually about 95, when the state capped the total dollar amount. It wasn't the levy rate that we capped, it was how much did you spend in 1994, 95. You could never levy any more than that dollar amount, and that's where this all started, I think way back then. So it's kind of confusing. You're never quite comparing apples and oranges here most of the time. So that one little piece that you mentioned, Russell, is probably where this whole thing started. And if I could know what year that was and what legislation that said, I'd like to see it as it was written. And I don't understand why they did that, other than just to hold property taxes down, probably, because it was an expenditure that seemed to have no limit to how much you could spend on it back then, and that's why that rate got put in there. But this is all good and fine comments, but I think we need to do something with the 25% or the 20%, and this year probably, and Counties certify their budgets March 15th. Is that still the same? So if we're going to do anything this session, we need to do it before March 15th. So I think I'd be willing to work on legislation to maybe do that. But the fear for everybody is this big balloon will suddenly expand it, and we'll have all kinds of people wanting to stop it from exploding. So maybe we just need to do it in little pieces. And where to start, probably the things that they're recommending, and that is the fund balances and the reserve funds. And Senator Volker makes a good point about the children's mental health system, which we're all very excited about, which really is just going to get tagged on to the regional mental health system. And that's another whole ball game that nobody knows what it will cost. But it's nothing scarier to see a little kid with mental health problems. It's just a sad thing to see, and we all see it. And if you're in school, you see it every day, and we need to address that problem. So, thank you, Mr. Chairman.
Thank you, Senator Representative.
Well, I just have a couple of comments. We worked so hard last year on our complex needs report, and we certainly passed legislation that was bipartisan, and we had a lot of buy-in from health regions. Being relatively new to the process, this committee was really important to our process that we did last year. Hearing from all of you, knowing now the information that we know that we didn't have available maybe to us last year when we were passing this bill. And I think that's an important aspect to point out. I am looking forward. I know the ACT reimbursement report comes out tomorrow. I think that reimbursement may change. I think that might affect some of the money that's coming into the regions, and I'm looking forward to reading that. And really appreciate the input that we've had from legislators here in the room.
Thank you, Representative Walker. I do want to just bring up, for clarification purposes, before I go into comments, we will be providing the report for January 15th of 2019, not December of 2019. I just want to make that clear. And I would somewhat echo Representative Bryan, expand on his rationale of what we have heard as far as the general direction and the overall rationale for what we need to do as a legislature as far as rolling back this thing down. I do want to see a little more information. As I mentioned earlier on, we have not even seen a Medicaid component of this put in a dollar value yet. Until I see that number, I do not feel responsible making a decision like this and putting a recommendation out. So I would like to see the Medicaid side of the puzzle, because that's not reflected in the MHPS budget. So I would like to put forward a recommendation to LSA to have all of our meetings basically summarize, the recommendations summarize that are coming from our presenters, and that we are diligently working to gather the final pieces of the puzzle, the final information pieces to make that recommendation. I would second that motion.
Could you restate the motion? Your LSA is going to write up what people said, and that's...
I don't have the exact wording on that. I guess the motion would be for the final report as prepared by the legislature agency to include all recommendations provided by all the presenters during both the October and the December meetings as part of that final report. Typically, LSA does prepare a final report for each interim committee. It generally will include summarized minutes and general information provided. In this case, it would be specifically to include all of the proposed recommendations from each of the presenters.
In response, I wanted to make sure that the legislators see what we saw, so they know where the limitations are of the legislation that's hindering the mental health regions right now. But I don't think we are prepared to give an exact number, an exact percent at this point, but I think we have a very grand idea where we need to go to help them out. Representative.
Thanks. So just for clarification then on the report, so are you suggesting it's not a consensus recommendation? It's just what each of us have said? I'm just a little confused because again, I'm looking back at, it says the committee will make recommendation to the General Assembly for January 19th or whatever. So is it as if I wrote my own report? I'm just a little confused. Can you clarify that, please, Mr. Chair?
Well, I guess I'm putting out the motion to leave it this way. I'm not comfortable putting certain numbers on it at this point because we don't have all the information just yet. But I think as a primary direction, we know what we need to do from our recommendations. And I think that's what's important, is to have that portrayed. As far as the spend down, relaxing that, looking at the levies. We got Senator Bolt.
Yeah, go ahead.
Thank you, Mr. Chair. Mr. Chair, I don't have any quarrel. I'm fine with the motion. We're just going to summarize what everybody said. I hope we get my comments down too. But it seems to me that the legislature in establishing this interim is looking for recommendations from members of this committee. Not just, I mean, all the committees, the LSA does a great job providing the minutes and all the members believe what people said. So I don't know. So there's that. I think the expectation is we've been assigned to dig into all the facts and stew over it and make recommendations on how to improve the system. You're saying you don't want to do that today. I think that, so that's where we're at. The motion's harmless, doesn't really do anything. Can you refresh us on the timeline for the report of this committee? Is in the charge of the committee, is it to report by December of 2019?
No, that's January 15th.
January 15th of 2019. So essentially your motion is not to make any recommendations. If we're just going to summarize what everybody said and not do any specific recommendations. Because I got, for the sake of academia, I'm happy to make a motion on some of the things that were talked about today, but I'm under no illusion about it actually passing. So maybe we could dispense with your motion and see if there's any other motions.
Representative Frye makes a comment.
Thank you, Mr. Chair. If we go back to the opioid work group interim that met last year, their outcomes and back to the legislature were a summarization of all of the meetings that took place so that the legislature could see all the different testimony components and the legislation that was drafted out of that and all of those comments. I'm suggesting that this is the similar sort of route that we would go with this, that we hear all of the committee, hear all of the testimony. We have the opportunity then to look at what's best within that testimony and put together our legislation that we would move forward next year in the 2019 session. So I don't think this is a meritless task. I don't think that this is a situation where we're putting forward nothing to the legislature. I think we're allowing the legislature to see all of the information and that we would then begin to put together our legislation based off the testimony today, but also testimony and reports that we're going to be coming in the coming weeks and the coming months. I don't know that we're ready to make a solid recommendation to the legislature about shall move forward this way. I think we're missing information. Thank you, Mr. Chairman.
Thank you, Representative Frye. That really echoes, I guess, what I'm trying to say. We have a general direction, and I think the recommendation is we know a general direction, but we do not know the specifics of how we want to get there with the missing information. So there is a motion and a second. All in favor?
Aye.
Opposed, same sign. Thank you. The motion shall pass on the recommendation. once again, I want to thank everyone for taking their time to come and help out on this very important issue. I expect all of us will be working in the near future to try and accomplish what we set out to do, and that is provide a sustainable funding source for MHDS region. So with that, thank you. Everyone have Merry Christmas, and we will Happy New Year.
I'm so glad I got dug into this. With no authority.
Let's see him having